Spoštovani gostje, dobrodošli ob nadaljevanju dvodnevne mednarodne konference na najvišji ravni o uporabi inovativnih rešitev za odporne zdravstvene sisteme, ki bo še danes potekala v Ljubljani in seveda tudi po spletu. Organizator je Ministrstvo za zdravje Vlade Republike Slovenije in je del aktivnosti v okviru predsedovanja Slovenije Svetu Evropske unije. Delovni jezik konference je angleščina, zato vas prosimo za razumevanje. We're now switching to English, the working language of the high-level conference of the Slovenian Presidency of the Council of the EU, organized by the Ministry of Health of the Republic of Slovenia. So welcome to the second day of the event. We discuss the implementations of innovative solutions for resilient health systems. This is a so-called hybrid event. We're hosted in a studio in Ljubljana Castle above the Slovenian capital. Some of the speakers are actually here, and some moderators will also be here. Some of the participants will join us online. The whole conference will be, of course, webcast. Some of the panels will also be interactive. The Ljubljana Castle provides an environment for the event with the highest security standards regarding measures against COVID-19. All attendees are either vaccinated or tested. Today, we're looking forward to the ministerial panel with several health ministers from the EU member countries. We will also hear the address by Professor Mario Monti, chair of the Pan-European Commission on Health and Sustainable Development, of course, the former EU Commissioner and former Italian Prime Minister. And I'm really pleased to announce the opening speaker of the second day. We go to a live feed to Brussels, and I have the honor to announce Madam Elisa Ferreira, the EU Commissioner for Cohesion and Reforms.
Mr. Koritnik, ladies and gentlemen, my thanks to the Slovenian Presidency for putting the topic of health systems so firmly on the agenda. In fact, COVID has renewed our understanding of the importance of health systems and that they must be able to react quickly and to innovate at short notice. In a word, we now call it resilience, but it is not just COVID. Health systems are undergoing a long-term change, a radical change, a change which you as experts know better than I do. And you focus on disease prevention, on primary care, and most importantly, patient-focused care, creating treatment pathways which tackle patient needs in a coherent way. This change requires investment, especially in digital technology, as well as adequate resources in terms of skilled staff, in terms of supplies, in terms of buildings and facilities, of course. Imagine just for a minute that you are director, or you may be a director of a large hospital, and you need to build a ward, department, or treatment center. Some of you may not need to imagine because it can draw on your practical experience. A new treatment center poses many questions. How will you finance it? Who will help you to tailor it? Tailor it to the needs of the patients, nurses, doctors. How will you plan and design the building? What digital systems will you use? How to make the technology you use be future-proof? Will the center be appropriately green? How will it fit the needs of the area it is supposed to serve? Will it be matched to future demand in that area, especially as geographical and regional demography changes? I do not have all the answers, but as Commissioner for Cohesion and Reforms, my services can provide different forms of support from healthcare professionals and for healthcare professionals and for local government. I will now briefly focus on three of them. Now, The first form of support, it's investment support. Of course, money is not everything, but it gets things started. I often say that it is a necessary, although not sufficient condition. In the 2014-2020 cohesion programs, we are, because the program is going on until, the payments go on until 2023, but we are investing nearly 19 billion euros in the health sector. This includes around 7 billion euros of emergency support under the coronavirus response investment initiative. The emergency support has included more than 5,000 ventilators and 2.6 billion items of personal protective equipment, from masks to gloves. Sometimes people are not aware that this emergency support came from cohesion funds. In fact, it was a unique emergency reaction, but it worked. And it has been working since the beginning of the past year of 2020. However, let us focus on the 12 billion euros of long-term investment. This is playing an important role in the long-term development of the healthcare systems all across Europe. So in this period, 2014-2020 programs, which are coming now to a close, more than 68 million people are benefiting from better healthcare infrastructure, including investments in primary care, community-based services, as well as disease prevention facilities and equipment. A key form of investment is, in fact, and more so, in digitalization. This is becoming increasingly important in all aspects of our daily life, and of course, health is no exception to it. The 2014-2020 programs have invested more, again across Europe, more than 1 billion euros in eHealth digital solutions, so making the digital capacities and capabilities adapted and useful for the management and the operation of the health systems. These investments helped to build research and innovation infrastructures, test new solutions, and bring new products and services to the market. We helped to provide telemedicine in remote areas. We also helped in the digitalization of patient care. This smart hospital approach, as we can call it, provided its worth, but very seriously so during COVID. For example, in Vall d'Hebron, the largest hospital campus in Catalonia, and an epicenter of the pandemic, digitalization enabled the rapid processing of patients in crisis without losing track on their information. So cohesion policy has made significant investments in the health sector. Since the 2021-20 programs, the ones that we are now negotiating with member states, are still in preparation, I cannot yet give you a figure for investments for this new period that we are starting from the 1st of January of 2021. But in the new regulations, we have made health an even higher priority. So I suspect that health investments may well increase, especially investments in digital health as well. And this brings me to my second point. As we prepare the new programs, we know that the investment alone is not enough. We must use it as a lever to promote reforms, as an amplifier, so to speak, to promote reforms and to build the 21st century systems and the 21st century skills and capacities. There is an instrument, we call it technical support instrument, and this instrument can provide expertise, if needed, for reforms and for the reorganization of new systems, as well as exchange of experience among health actors across Europe. We don't have to reinvent the wheel if someone's have done it before us. For example, we supported Slovenian authorities as they reviewed the law on long-term care. The new law, now in discussion in Parliament, would lead to integrated health, social security and pension protection services. The draft law would also enable the provision of long-term care services at home, in community centers or in homes for elderly people. So this is not an imposition, this is on demand. It's just a technical support to facilitate life to local governments, to hospital administrations all over Europe, not only in health sector, but also in other sectors. We have also supported the Slovenian Ministry of Health with peer-to-peer learning for the mapping of future needs and future investments. And indeed, Slovenia is now one of the front runners in mapping future needs. At the end of June, we launched the annual call across Europe for technical support projects for the year 2022, for the next year then. We'll be supporting multi-country projects, and we propose to work with member states on flagship projects for digital skills and the digital transformation of health and care systems. Indeed, we stand ready to provide technical support for the design of the national or regional roadmaps for digital skills. Such roadmaps would provide a basis for understanding the digital needs and actions to build the digital competence of the health and care workforce. And this brings me to my third point. The health sector as a key innovation sector and the driver of the local economy. And sometimes we forget this aspect, and it is so important. As Europeans, we are all proud, and rightly so, of the Pfizer-BioNTech vaccine developed by the German company BioNTech, as you know, then associated later on with Pfizer for the production of the vaccine. But did you know that BioNTech started with a 2.2 million euro grant from Cohesion policy to kickstart their research? Often we don't know it. And this is not, this is not an isolated example. The smart specialization strategies, that's how we call it, they guide investment opportunities in cohesion policy. Nearly 80% of the current strategies, of these smart specialization strategies, prioritize, in fact, health as one of the key sectors for investment. In the 2014-2020 programs, 3.5 billion euros was invested in research and innovation projects in the fields of health and life sciences. But currently, in our innovation partnerships, we have 5 thematic partnerships in the area of health. We have one on medical technologies, on personalized medicine, on nutritional ingredients, on COVID-19 related innovative solutions, and on circular economy in health. These investments and these are partnerships will only grow in the new programs. Innovation is of course key for resilient health systems ready to face the challenges of the 21st century. But this innovation can create a competitive advantage. As in the case of BioNTech example shows, it can create a new industry, it can create new jobs. And these benefits can spread across sectors, across regions, across countries. And to facilitate these spillover benefits in new cohesion programs, we have introduced a new instrument for interregional innovation investments. This will help smart specialization partnerships to scale up innovative solutions and to accelerate the market uptake of those innovations. So in conclusion, I return to my example from the beginning, the hospital or a healthcare provider, improving the hospital or healthcare center, building a new ward or department or treatment center. In cohesion policy, we are ready to help you with investment and especially to take this opportunity to digitize and modernize. In reform policy, we are ready, and these are 2 general directorates that are under my responsibility. But in fact, reform policy, we are ready to help with expertise, internal or external, reforms and improvements to the system, drawing on experience from across Europe. And under cohesion policies, smart specialization strategies, we are ready to invest in the healthcare of tomorrow and the jobs of tomorrow. What is the next beyond tech? Probably it is in Slovenia. In all of this, our vision is for all Europeans to benefit from a modern, well-resourced healthcare system and for new and exciting jobs in the sector. Europe is supporting in many ways, and I am aware that we have a lot of instruments. I have referenced it half a dozen, and there are many, many more. So I and my services are reflecting on ways of cutting through the complexity and making the system more user-friendly. We are still collecting ideas, but I would love to hear also from you. And above all, I want to hear about your plans for the 21st health system, which leave no person, no region behind. So we'll be listening to you, but we are partners in this fight against disease and in improving the quality of life of all citizens, doesn't matter where they happen to be born. Thank you very much once again, and congratulations on your initiative and all the success to the Slovenian presidency. Thank you once again.
Thank you very much, Madam Commissioner, and we wish you a lot of success, because your success will be our success too, as Europeans.
Thank you.
So, have a nice weekend. As I said, we will have several ministers in the Ministerial roundtable at 11 o'clock here, but I'm now pleased to announce the first minister to speak today, at the second day of the conference, the Minister of Public Administration in the government of Slovenia, Mr. Boštjan Koritnik.
Ladies and gentlemen, distinguished guests, dear participants of the conference. The society we live in has been facing with new technologies and their impact on our lives for many years. However, digital transformation still brings new challenges. The COVID-19 pandemic has unimaginably accelerated the process of digitalization, as we are literally saving lives thanks to them. We are well aware that digital transformation, digital technologies, and cybersecurity are key to Europe's faster recovery from the COVID-19 pandemic. Therefore, they are high on the agenda of the Slovenian EU presidency priorities. Today, I would like to briefly describe some of our most important digital achievements, which are innovative and contribute in a large extent to resilient healthcare systems. Last year, together with the Health Insurance Institute, we introduced the new electronic sick leave service on our Spot portal for business entities. Previously, doctors had to issue a written certificate of sick leave, and the employee delivered it to the employer to be able to claim reimbursement from the Health Insurance Institute. The new service has digitized the process. Data is now exchanged between doctors, employers, and the Health Insurance Institute without the active role of the employee. The Spot portal service serves as a platform for data exchange, and employees have access to their own data through the portal of the Health Insurance Institute. The process is now fully digitized, and its use has been mandatory from this February. Both patients and healthcare professionals, as well as employers and other stakeholders, benefit from this digitized solution. The estimated savings are 11.5 million euros annually for all stakeholders involved. This proves that the potentials of digitization are enormous. It is important, however, that stakeholders actively participate in co-creation of the service. Digitization alone is not enough. Optimization is key when using digital tools. I must also point out a successful introduction of the Ostani Zdrav, Stay Healthy mobile application that informs persons if they have been in contact with an infected person with COVID-19. This application has so far been downloaded by almost 400,000 people in the country. We have proven that we can be successful even with small financial investments, thanks to expertise and agility. During the pandemic, we noticed a significant increase in the submission of electronic applications on the e-government portal. We introduced electronic delivery of documents in administrative matters. Since November 2020, administrative units, ministries, social work centers, the Surveying and Mapping Authority of the Republic of Slovenia and others have been delivering documents to citizens in a secure electronic mailbox on the e-government portal. This is a winning combination of simplicity and focus on user needs. The ZVIM portal, web portal, which is one-stop shop for health services, is a modern electronic tool which provides to patients a better access to their medical documentation, such as medical results, appointments, referrals and prescriptions, and much faster access to healthcare providers. The portal enables patients to order services more transparently and easily, as well as to have better control over issued prescriptions and medicines. The portal enables fast, confidential, and reliable communication and offers users all information about their health situation. At a time when the web is becoming the dominant way of living and doing business, proving and relying on your identity in the digital world is even more important, especially when it comes to our personal and health data. Currently, the most widespread in Slovenia are qualified digital certificates from various issuers, both from the public administration and the private sector. But recently, more modern methods can be used to prove one's identity. Namely, we can use our mobile phone, which is enabled by the SMS Pass service. In order to allow as many citizens as possible to access the ZVIM portal, which is certainly the most used service in the public sector today, we are adding new registration service sites every day. At these new points, we encourage the acquisition of primarily mobile e-identity SMS Pass as a more modern way of demonstrating our identity. In Slovenia, at the beginning of 2022, we will introduce the electronic identity card, which is a new modern ID card with biometric data. A high-security electronic identification tool will enable citizens to have a high-level electronic identity. Also, it will be possible to use the e-ID card in the procedures in which we now use the health insurance card. On the same legal basis, the identity card will also be the holder of a digital certificate for electronic signature, which will enable the execution of an electronic signature equivalent to a handwritten one. Ladies and gentlemen, these are some of our most advanced digital services in the health sector. Let me conclude by saying that the objective of all our activities is faster digital transformation, which will provide better service for citizens and businesses, and thus a better quality of life for all of us. I wish you a very successful conference. Thank you.
Thank you very much, Mr. Koritnik, dear Minister. At 11 o'clock, we'll have the Ministerial roundtable. At 12 o'clock, so high noon local time, we'll have Mr. Monti. And at 12:15, we'll conclude the conference with final remarks by the Slovenian Minister of Health. But now we're heading to a very interesting expert panel on new opportunities for a stronger health system. I'm really pleased to announce the moderator, Madam Maya Matthews, Head of the Performance of National Health Systems Unit at the Directorate General of Health and Food Safety.
Good morning and welcome to this session on new opportunities for funding health systems. Today we have 3 speakers from the European Commission who will share with you 3 different funding programs under the new multi-financial framework. We will also have our final speaker who will share some of her experiences on how to identify innovative solutions in health systems and present a new initiative bringing together member states to work together in partnership on health systems. We heard yesterday some very interesting best practices, and so today's session will really delve and drill down into how, through these new funding instruments, we would be able, member states would be able to access and harness these funds to be able to work on the health system's resilience. So, without further ado, I would like to introduce our first speaker. Adrian Perez is from DG Sante, where I work. He is the team leader for the new EU for Health program. Welcome, Adrian, and the floor is yours.
Good morning, everyone, and thank you, Maya, for the kind introduction, and thank you to the organizers for the invitation. I'm Adrian Perez, and I'm leading the task force, EU for Health task force, that is responsible for the programming and part of the implementation of the EU for Health program, as well as its monitoring and evaluation. The program has been adopted early this spring, and it is the response to the COVID-19 pandemic, but it goes much beyond that, bringing an ambitious vision to support and complement national health policies for strengthening and modernizing health systems and reducing inequalities. It is the largest ever EU investment in health, with an envelope of 5.3 billion euros in current prices, of which a minimum 20% is reserved for health promotion and disease prevention. A maximum 12.5% can be spent for complementing national stockpiling of essential crisis-relevant products, and a maximum 12.5% for global commitments and health initiatives. Administrative expenses may go up to 8%. But what is the purpose of the EU for Health program? What are its general objectives? First and foremost, the program aims to improve and foster health in the Union, protect people from serious cross-border health threats, improve access to medicinal products, medical devices, and crisis-relevant products, and last but not least, strengthen health systems. This is done through 10 specific objectives, and I would like to focus on the health systems objectives, the 4th one, that comes with strengthening health data, improving digital tools and services, and digitalization and transformation of healthcare, as well as enhancing access to healthcare and integrated work among member states' health systems. Some of the legislation is relevant to this dimension as well. The EU for Health program regulation is defining yearly work programs. So the Commission is adopting work programs every year, and the first one has been adopted very recently on the 24th of June. It does come with a more than 300 million budgetary envelope that sets, and the program sets priorities and actions for 2021. It doesn't mean we have to spend all the money in 2021, which would be very difficult, but we have to engage that spending already in 2021. For that, we have developed this program, and half of it is allocated to grants, and the other half to procurement. So I would like to emphasize that the 50% allocated to grants is the best opportunity for the member states' authorities to access the funding program. how it is structured, the work program. The work program has been structured by the Commission together with the member states along 4 main strands: disease prevention, that includes health promotion as well, crisis preparedness, health systems and healthcare workforce, and the digital strand. Across these 4 strands, we have cancer. That is a very high priority on the Commission agenda. What is the health program and its annual work programs? It is an implementation tool for both legislative and non-legislative initiatives of the Union. And in 2021, it focuses on fighting the pandemic, as well as bringing forward the Europe's Beating Cancer Plan, but also in implementing the pharmaceutical strategy for Europe and relevant EU health legislation. It doesn't do this in a vacuum, but rather in synergy and complementarity with other EU programs. And while in 2021 programming, it was almost impossible to synergize with other programs due to asynchrony between the adoption of the programs, for 2022, we are aiming for deeper program level synergies with, for example, Horizon Europe, Digital Europe, but also the food chain program, InvestEU, and Erasmus+. This year, synergies are possible at the action level during the implementation. So without the aim of developing on this very detailed information, I would only like to emphasize that disease prevention strand comes with a budget envelope of more than 100 million euros, and it sets specific priorities that are then implemented through joint actions, and that is the instrument that the member states have at hand to access the funds. I will go more in details on that when I present the health system strand. Crisis preparedness comes with a similar budget envelope. And while the digital strand this year has less money allocated, about 33 million, it does provide for an advance for the European health data space. So, as I said, I would like to go deeper into the health system strand, which has an allocated budget of about 70 million. And priorities range from improving access to healthcare and effectiveness of health coverage to forecasting and planning for workforce in the healthcare sector and health systems resilience testing and support program. So it touches upon substances of human origin as well as implementing specific legislation. Now, what is really important, as I said, for the member states is to look at the joint actions dimension that is only open to the member states. So in the 2021 work program, we do have 4 direct grants to the member states. These are non-competitive grants accessible only for member states authorities and in some cases to their affiliates. So transfer of best practices in primary care comes with a budget envelope of 10 million. Health workforce to meet health challenges with a 7 million budget envelope, and promoting quality of medicines and increasing cooperation through trainings and joint audits and reassessment and inspections with 2 million, and safety assessment and cooperation to facilitate conduct of clinical trials with a budget envelope of 4.5 million. Allow me to emphasize the 2 joint actions that are specific for the health systems. The first one is on, as I said, on the transfer of best practices in primary care. The aim of this action is to help member states to transfer best practices, including knowledge, from one to another, but also to support them in raising their capacity in implementing innovative care models. The expected result and impact of that is innovative approaches and reforms for strengthening health systems, but also improving health outcomes and increasing the safety of patients. The other joint action refers to meeting health challenges and meeting challenges of the health workforce, but also on forecasting and planning for workforce in the health sector. The budget envelope for this action is 7 million, and the aim is to increase capacity building and develop knowledge datasets for workforce planning. It also aims to support the member states' effective forecasting and planning for health workforce. The results and impacts foreseen are an increased health workforce planning and forecasting capacity, and solid principles for extended datasets use and tools for workforce planning and forecasting. To wrap up my intervention, I would like to emphasize that the EU for Health program, through its joint actions, represent a huge opportunity to reinforce cooperation and collaboration between member states, as well as increase their capacity to implement health systems reforms. It includes, in 2021, we have 15 such joint actions, 4 are directed to health systems, so there is a huge untapped opportunity for the member states. In total, across the 4 strands, 81 million are available to the member states authorities and their affiliates only, so other beneficiaries cannot apply to this. Letters for nominations, invitations to nominate the national authorities have been sent, and we are expecting your nominations. And yesterday we have organized a dedicated info day a general dedicated info day on joint actions for member states authorities, and 2 more information days will follow with the nominated authorities. So with this, I would like to close my intervention, and I'm looking forward to the panel discussions. Thank you.
Thank you very much, Adrian. Thank you for that comprehensive overview of the new EU for Health programme and the Work Plan 2021. If I can just ask you a quick follow-up question that I think that the audience would find useful. You explained very clearly what is in the Work Plan 2021, but maybe you can also explain how the different work plans over 22, 23, how that will be organised and what opportunities there are for member states and for other stakeholders to be able to input in the future work plans of this program.
Thank you, Maya, for that question. And we have just started the programming for 2022 work program. As I said, we are developing annual work programs, and we have launched a stakeholders consultation on the 2nd of July, which is opened until the end of August. Normally, it should be open for 4 weeks, but we've doubled the time in view of the summer. So member states can contribute through the EU for Health steering group, first and foremost, where discussions and consultations with the member states authorities are taking place, but as well through the stakeholder consultations and other expert groups that the Commission has put in place.
Thank you very much. So everyone listening out there, please, we're inviting you to submit your ideas in this open consultation for the Work Plan 2022. Thank you, Adrian, and look forward to discussing with you in the panel session. Before I introduce our next speaker, I would just like to invite all the audience members, if you have questions for our panel discussion, please put them in the chat, and then we can then take forward some of the questions. So I would like to introduce our second speaker. Dr. Irene Norstedt is the Director of the Directorate People in DG Research and Innovation, and she will be presenting the Horizon Europe program, the biggest research and innovation program, I think, ever in the EU's history. So, Irene, over to you.
So thank you very much, Maya, and good morning to everybody. It is a pleasure to be here today, and I would, of course, especially like to thank the Slovenian Health Ministry for organizing and inviting me to this important conference. And I'm really sorry I cannot be there in person, but I'm happy to be with you through this electronic mode. And I think this is one of the more positive lessons we have learned over this past 1.5 years, is that how much more we actually can do digitally or using these hybrid tools. I'm really glad that the resilience of healthcare systems and the role of science and research in the recovery will be in the focus of the Slovenian presidency. And as many speakers have said before me, these past years has really emphasized the need for strengthening our health systems. And to achieve results in this field, it's crucial that we do work together, and impact at the societal level is what we strive for also in Horizon Europe. So today I would really like to focus my presentation on two things, namely the role of research and innovation in strengthening health systems, and also the importance of working together. So I start with the role of research. So investing in health research is of course crucial to make sure that healthcare is constantly improving and developing. And research and innovation can contribute to making health and care systems more accessible for citizens, to make them more patient-centered and sustainable. And the digital transformation is of course an important tool for all of these aims. However, in the end, the success of research and innovation activities is expressed by the number of new technologies and research outputs that really reaches the end users. And those are, of course, the citizens or the patients. Therefore, to achieve the desired impacts, we need to work with them, with health professionals, with policymakers and other stakeholders in developing the research agenda and in identifying the real needs. In doing so, we can increase the degree of the uptake, the implementation and scale up of recommendations and innovative solutions developed through the research and innovation. And as we know, knowledge knows no borders, and collaboration at various levels does not just improve the success of the implementation and bring added value in terms of quality, it also is necessary to guarantee that public investments in knowledge generation is used wisely. So with the COVID-19 crisis, healthcare systems all over the world has been put under an incredible stress, but it has been very well known for quite a long time that healthcare systems needs to be more sustainable, accessible, cost-effective and resilient, and that we need to reduce inequalities. Europe needs to work together and learn from each other to accelerate this transformation. And what better way to do that than through cross-country research and innovation? Research that focuses on health and care systems is fundamental for all health research and innovation activities. And here we really can make great progress in the field of technological innovations. But if we do not have the infrastructure and the organizational knowledge to make sure that new innovations are implemented in the health systems, then they might never reach the healthcare providers, the healthcare professionals, and ultimately benefit the patients. So therefore, health systems research has had an important place already in our previous research and innovation program, Horizon 2020. And in our new program, Horizon Europe, we have 6 destinations in the health cluster that specifically is dedicated to health research. And here actually one of those destinations is exactly dedicated to research and innovation focusing on healthcare systems. So with that, you understand the importance we are also putting on this aspect. The research activities that we will finance should ultimately provide decision makers with new evidence, methods, tools, and technologies for uptake into healthcare systems. We have already launched the first work program of Horizon Europe. It was launched on the 15th of June and it is available. We have also had information days which are available on the web. They are recorded, so there you can also learn a lot more and a lot of details about all the different opportunities for funding in this first work program, years 2021 and 2022. So in this program,
I think we have lost Irene.
You will
Oh,
Can
good.
you hear me?
Yeah, you froze,
Yeah,
but
am
you're
I
back. That's good. Yes, yes. Please
I'm back.
continue.
Yeah, I saw a little notice on my screen. I'm sorry for that. So I don't know if you lost me. Can you hear me still?
Hear you. We can hear you.
You can hear me?
Yes.
Okay, good. My screen looks a little bit strange, but I'm glad you can hear me. So you will find, as I mentioned, you will find the research and innovation actions in several fields of quality and care of patients, safety, data-driven decision support tools, and financing models for health systems. But you will also find several calls for innovation procurement instruments. And this is something we have started to use over these last years. We find this a very important tool because that promises a shift from technology push to technology pull, in which allowed the healthcare organizations to define their most urgent needs and then to call for providers to respond to those needs. And here, this is really, really important for us. So I really would invite you to have a look at those topics. I would also like to mention partnerships, because we very much like to work in partnerships in research. And here we have different type of partnerships. And I think there are several partnerships which are very, very relevant for our discussion today. One, for example, is the new partnership proposed on transforming health and care systems. So here it's responding to a wish and a need that actually has been identified by you in the member states. And we have put in our work program a call for a European partnership on transforming health and care systems. I will not go into the details here on this partnership, because later on in this session, you will listen to Sabrina Montante, and I believe that she will tell you a lot more about this partnership. But I want to elaborate a little bit more on the reasons of why we do see a need for this co-funded action. I should mention that this partnership, as I mentioned, is a co-funded action. So that means that we will work together with research funding organizations in the member states, that we will co-fund the research to be done in this partnership. So this new partnership is really aiming to bring together the whole value chain of stakeholders, and thereby taking the complexity of Europe's health and care systems into consideration. And we believe that the partnership will give the necessary framework and necessary ambition to address gaps in research and innovation, gaps in knowledge translation from one context to another, and gaps in the implementation and scaling up of cost-effective innovations, and of course the strengthening of the research capacity in the member states. We also have other type of partnerships. Some of them are also with research funders in member states, and I would like to in particular to mention the partnership of rare diseases that we already have. In this partnership, we are really bringing from bench to bedside together, because there we are bringing together both the research together with the data collection and also with the European reference networks, and also the patient registry hub, and thereby creating an ecosystem to make sure that research results quickly can reach out into the health systems and reach those who need them. But also to bring back the valuable information from health systems into defining the further research needs in that area. Another important partnership will be the new partnership with industry. Some of you are already familiar with the Innovative Medicines Initiative, which is a partnership with the pharmaceutical industry. But we are now setting up a new partnership, and this is now in negotiation as a new joint undertaking called Innovative Health Initiative, in which we will bring together not only the pharmaceutical industry, but also the medical device industry, the imaging industry, the vaccine, and also the digital health digitization industry. And by this, we will have a full ecosystem that will really look at this new way of integration of different technologies, and we will soon see new generations of products where you really bring the different systems together. You may have a screening tool, you may have a diagnostic, you may have a therapeutic, you may have a sensor that collects data, the real world data that then will feed into information for pricing, reimbursement, but also in terms of regulatory needs. So we're looking at the new generation, and the questions we have here is really, how are we going to bring that all together? How are we going to bring all those new type of products out into the health systems? How can we look at harmonizations, and maybe we also need new regulatory pathways? We do not know, because today, you know, you have discrete pathways for different type of products. So this is what this new type of partnership will work on. And we see, of course, a close interaction between that one and the partnership on health systems. They will have different focuses, but we foresee them to work closely together. So here, this is a way that we very much like to work in health research. It's really to bring together actors and thereby sort of maximize the capacity of research investments, but also to share knowledge and information between actors, between different type of actors in the health ecosystem, and also between countries. And also, I would say, also at regional level, because we also shouldn't forget that a lot of the experience are actually being done at EU level. So to maximize the benefit of all these EU investments, we're really looking at the synergies with public health policies, as I mentioned, at national, but also regional level, as well as with other EU programs. And you just heard from Adrian about the EU for Health program. And we will also work in synergy with many other programs to make sure that research results will be taken up and rapidly being taken up into the health systems. So because I mentioned in the beginning that achieving impact is really a top priority for Horizon Europe, and within this framework program, we are also introducing a new concept, which is missions. And the missions are fully aimed at achieving concrete and tangible impact. And you are familiar, I think, with the cancer mission, which also works very closely and will contribute to the Europe's Beating Cancer plan. On another hand, we also have created the European Innovation Council, which aims to support breakthrough innovation in terms of to rapidly reaching the market. So synergies and collaboration with other partnerships, EU programs and stakeholders will really be fundamental for all the activities that we do under Horizon Europe. And the Horizon Europe program has also been shaped with the help, among other services, member states and stakeholders. We have had many stakeholder consultations, and we also work very closely in the Commission, and we are really co-creating, and actually we are sharing the management and development of this program from DG Research together with DG Santé, and as of now also with DG Connect. Because it's really important that we do work together and make sure that we use the complementarities of the different programs, which has different objectives, but really can work in synergy. So that is really a very important aspect from us. Because by doing that, not only will we avoid overlaps and duplication, but we really can enhance the overall quality of our work. So additionally, early involvement of stakeholders and input from actors with complementary expertise is really important for us. And we would like to see them participating in all the projects we're funding. Research funding is not only for researchers. We would like to see all actors. We do have health ministries participating in our research programs. We do have health insurers, we have regulatory bodies, and of course, very importantly, we do have patient organizations. And that's something which is really important in the research that we're funding, to make sure that the research that we fund and the new innovations that come to the table are really meeting the needs as the patients see them. So that is another aspect I really would like to put on the table. So Horizon Europe and the EU for Health program will, of course, strive for maximum synergies to achieve maximum public health impact. And we will, well, Horizon Europe will really focus on creating new knowledge and know-how, where we see the EU for Health program is focusing more on making the best possible use of this new knowledge for the benefits of health systems and the citizens. And also we hope that the EU for Health program also will provide feedback into the Horizon Europe program in terms of what are the knowledge gaps that we should focus on to generate new innovations. But we also have other programs that we will work in synergy with, such as the Digital Europe program, Invest EU, the various cohesion funds, and of course the Recovery and Resilience Facility. And in addition, there will be an added value derived from previous initiatives in the field of health systems research. I mean, we don't start from scratch. So that means, on the contrary, that we will build on the research that we have already invested in, our policy work and the experience and the lessons learned from the projects and initiatives that we have funded over the previous programs. So to sum up, I'm very glad to see that the priority of the Slovenian presidency is giving to the resilience of healthcare systems, and we are really a committed partner to bring forward new innovations in this field, and we are really looking forward to very good collaborations in the years to come. And I will stop there. Thank you so much.
Thank you so much, Irene, and thank you already for pointing out the links with the other programs, and also for providing us with such an excellent overview of the different types of partnerships that Horizon Europe has. I wanted to just bring up one issue, and maybe you can answer quickly before we move on to the next speaker. But yesterday we heard about how, you know, health systems were really not prepared for this pandemic, and we do have another health crisis looming, and that's antimicrobial resistance. I was wondering how the Horizon Europe program can help member states already at this stage, preparing, planning. I know that you've already worked a lot on AMR, but is there something that you're already doing in this program?
Absolutely. So thank you, Maya. Indeed, antimicrobial resistance has been a priority for us for many, many years, because we know that this is really a very, very important area. So we already have a number of partnerships in the field working together to support the different avenues and aspects of antimicrobial resistance. So of course, we have different aspects such as hospital management, we have the agricultural aspects, the husbandry, and of course also the need to develop new products. So here we have also foreseen to come with a topic in a future work program, and preparations are already ongoing in setting up a very comprehensive partnership with a One Health approach on AMR. So today we have different type of partnerships working on. One that works more on the health side, we have on the human health side, we have one that works more on the animal health side and agricultural aspects. There is another one working on environmental aspects of antimicrobial resistance, and now we would like to bring those together into one comprehensive partnership, and their preparations are already ongoing. And we do have a small topic for coordination and support actions already in the first work program to further support the preparations. And because we believe it's really important that, again, all the different actors need to work together, because it's not a quick fix here. We cannot fix sort of one part of that problem, whereas another problem is still ongoing. So we really need to work together. So here again, anybody interested are happy to come forward to us, and we will put you in contact with those who are working on preparing for this other partnership as well.
Thank you so much, Irene. Good to hear that there's a lot happening in the AMR front, and looking forward to discussing with you in the panel discussion later on. So now, dear colleagues, we move on to our third speaker. We've heard about the health program, we've heard about the research and innovation program, and now we're going to hear about the digital program. We've heard so much in the last day about the importance of digital health solutions. We've heard how digital technology, telemedicine leapfrogged or accelerated during the COVID-19, and now we're looking at how we can harness what happened, how can we leverage what happened without leaving anyone behind. So it's my pleasure to introduce my colleague from DG Connect, Ceri Thompson. She's the Deputy Head of Unit of the eHealth, Wellbeing and Aging unit. Unfortunately, Ceri is not available today, but she has sent us a video message with a presentation. So.
Hello, everybody. My name is Ceri Thompson, and I'm the Deputy Head of the DG Connect unit responsible for eHealth, Wellbeing and Aging. And I'm going to give you an overview of the actions that are coming up in terms of the EU programs and initiatives that are in support of. So what is the political level in the Commission saying about digital health? Well, in the mission letter from Ursula von der Leyen to Stella Kyriakides, there was a request to her to work really to make the most of the potential of eHealth, to provide high quality healthcare and reduce inequalities. And she requested Kyriakides really to work on a European health data space that could be used to promote the exchange of health data, to underpin research into new preventive strategies, as well as on the next generation of treatments, medicines, medical devices and outcomes. And in particular, she stressed the need to build into this approach that citizens will have control over their own personal data. So I think also to take a look at the broader policy frameworks for what we're doing. It's still the case, this is from the communication from 2018, but I think it's still very much a framework that we're working within. We've got the three overarching goals that we had in 2018, which is firstly to give citizens better access to the health data wherever they are in the EU. Then secondly, to redevelop the health data that's available for research. So this is particularly about further digitalizing the data, making it linkable across borders, putting in place the necessary infrastructure where that's required. And then thirdly, it's about developing the digital services and the digital tools so that we can really use these to become empowered with regard to our own healthcare. And of course, it's important to mention the pandemic and the role that this has played in the policy framework. It's clear that the pandemic has shown the value of health data in a crisis, and we've seen a much better appreciation of the value of digital tools for keeping our healthcare systems resilient. And so we've really understood that there's a need to accelerate what we're doing. I would also like to briefly describe the framework that we have in place now with the publication of the EU data strategy, published in February 2020, which is all about putting in place the right conditions, the right tools, the right frameworks for data to flow freely within the EU, even across sectors, and for the benefit of businesses and researchers and public administrations. And it intends to deploy through 4 pillars. The first pillar is focused on governance and getting the governance framework in place for data access and use. The second is about deploying through enablers. So these are perhaps large pieces of infrastructure, such as supercomputing or cloud infrastructures, that are really needed to help the data flow. And these are foreseen to be based on very large investments between the Commission and the Member States. The third pillar is about working on the competences and investing in competences to support both digital literacy and skills in citizens, but also in the workforce or in the public administrations or in the private sector. And the fourth pillar is about rolling out common European data spaces across a number of sectors, but of course the one we're most interested Here is in the European Health Data Space. So in the context of the data strategy, there's a lot of work going on to develop the governance frameworks for the use, reuse and sharing of data. And these are building on the directive on open data and the reuse of public sector information, which is also known as the Open Data Directive. That's from July 2019. So this slide gives an overview of what is recent and what is coming up. And these are, of course, horizontal acts relevant for all kinds of data, but therefore also relevant for health data too. Just to give you an example, the recently adopted Commission proposal for a Data Governance Act, this is from December 2020, addresses the reuse of sensitive data held by public sector bodies in its Chapter 2. So here we're talking about health data held by hospitals and other health providers. And as part of this, it leaves room for member states to really define these, but it aims to create at least one contact point for liaison between users and the public sector entity on the use and reuse of sensitive health data. For inspiration for what it is hoped for here, we can look to Finland with FinData and France with the French Health Hub. These national entities being set up to support governance of national data sharing, and we could also foresee a role in cross-border data sharing too. Also, in the draft proposal for a Data Governance Act, in its Chapter 4, it provides for the regulation of data altruism organisations, and these could be regulated entities to which people could choose to provide their data to support actions for the common good. And these organisations may be created now and would need to meet specific requirements, for example, in terms of how they handle the data, assuring appropriate protections, for example. And then the slide gives a further schedule of updated acts during 2021. So what are other significant legislative proposals for health data in 2021? Well, 3 weeks ago, the Commission came forward with a proposal for an AI regulation. And this is a horizontal framework, again, for the governance of AI in the EU. And I think many of you will already be familiar with the work of the high-level expert group and the ethical principles that they have developed. And the regulation is very much building on this. In essence, it takes a risk-based approach to AI, and it focuses on the uses of AI that are considered to pose high risk to society. And of course, the health sector has been a key sector in our minds in developing this, and many AI applications in the health sector will be high risk, and certainly those that will be subject to third-party assessments under the medical devices regulations are going to fall into this category. In that case, then, the regulation sets out new requirements that these digital technologies are going to need to comply with as part of the existing conformity assessments under the medical device framework. And the other significant proposal is, of course, the expected proposal for a European health data space. I'll give you an overview on this just in a moment, but I just wanted to alert you all to the fact that the public consultation for this is now open. So we do urge you to go and look out for that and provide your comments. So the European Health Data Space, well, this of course aims to create a data space that can support better healthcare, better policy making, better research and innovation. It also has 4 pillars to it. The first pillar is the legislative proposal itself, and this will seek to tailor the governance, more to the specificities of the health sector. So for some aspects, it will build on the platform provided by the Data Governance Act. So it's very complementary to that. So the European Health Data Space will go further and propose a framework for the interoperability of health data, legislative aspects linked to the infrastructure needs for primary and secondary purposes. Of course, primary being about the clinical use of the data, and secondary being about research actions. And it's also going to complement the proposal for the AI regulation just adopted by proposing a framework for issues around AI liability in health and care. And otherwise, the European Health Data Space term, it's more than just this legislative proposal coming up. It also covers a number of actions that are ongoing to develop the quality of data, the infrastructure, and in terms of capacity building and digital skills. I mean, I say some of these actions are ongoing, others actions will be launched in the specific context of the new multi-annual framework, financial framework that will start very shortly, because a number of actions are foreseen under the different programs there. So, for example, there's going to be activity, that there is already ongoing activity to develop technical specifications for the exchange of health data, so further elaborating the European Electronic Health Record exchange format that was published in a Commission recommendation from February 2019. And here we have a project with member states called eHealth, which is ongoing, that will deliver the next set of technical specifications. So for lab tests, hospital discharge letters, and medical images, and this is expected in the middle of 2022. I think also particular to highlight here is that the Commission is launching a pilot project this year in 2021 with a number of partners, including the European Medicines Agency and the ECDC, and it's basically all about seeking to test a possible infrastructure model for health data, for electronic health records for research purposes. What's the most appropriate kind of infrastructure that should be put in place there? In the landscape of the European Health Data Space, let me just remind you of the work we're doing to develop secure access to other kinds of health data in addition to electronic health records. So in particular, there's the 1+ million genomes initiative. That's not new, of course, but it's highly active and aiming to provide access to a critical mass of genomic data across the EU, which will be essential to really advance research and our understanding of many diseases. And this work will now enter really an important phase as we have new actions planned under the forthcoming Digital Europe programme that will support the deployment of the infrastructure needed to make the data securely accessible across borders. I would also like to inform you about our plans for a European Cancer Imaging Initiative that we announced in the recent European Beating Cancer Plan. And this is something we would like to be a state-of-the-art platform for innovators to pilot technologies that will target cancer. And essentially, it consists of an action to develop an EU atlas of cancer-related images, essentially a store of anonymized images, and then make these available to researchers and innovators alongside whatever else they need in terms of, for example, supercomputing facilities and AI algorithms. And again, of course, there's all with a view to support the development of faster, more effective diagnostic and treatment tools. So how will it do this? Well, it intends to link a number of existing initiatives into one cancer health data focused task in the following way. So firstly, it will bring together the data created by an existing portfolio of projects that we're currently financing. And those are these 5 projects shown here. They're all working to develop health images data for different kinds of cancer. And they're also working on things like the anonymization techniques, on how to make the data work with the AI, how the AI algorithms will work, and on various aspects of infrastructure and other considerations. And we have these projects working in close contact with each other so that, where it's important, they address common questions together, and so that at the end it's going to be very easy both to bring the resulting data together and also to use all their findings in the creation and deployment of the actual cancer platform. The projects all started last year and they will run for 4 years. So then the idea is then, in addition to the projects, we will also have an additional Europe program project that will seek to combine those data with other existing ongoing actions that Connect is working on, such as the planned new testing and experimentation facilities. And so the testing and experimentation facilities are intended to be sort of very large, relatively few infrastructures co-financed by the Commission and the Member States that will provide resources for innovators to combine access to data with a resource for the AI algorithms and link to the EU supercomputing facilities. And another feature of these infrastructures, which may be possibly focused on specific sectors such as health, another feature is that they will also give access to the innovator to real-world conditions for the testing of the technologies. So in this case, access to clinical environments and to real patients. So it's very much intended as a resource that you would use towards the end of the development phase, where you're starting to think about putting the product on the market, preparing it for the market. Also looped in as part of the European Cancer Imaging Initiative will be the digital innovation hubs. Now, these are more intended to be complementary to the testing and experimentation facilities. They will be more numerous, smaller centres. They may also be specialised in particular sectors. They may not be, but they may be. And they would really act as then first ports of call for local innovators and potentially support the development of an energised regional ecosystems. So there could be a place where, for example, the innovator could go and learn about the legal requirements of putting their product on the market, and also what resources are out there for them. In this case, for example, the TEF and other resources. So putting all these elements together in this way, we want to create a very large, sustainable resource of anonymized cancer images that are easily accessible with the necessary tools to boost innovation in fields such as cancer diagnostic and treatments. And so, advance personalized medicine and enable the next generation of diagnostics and treatments for cancer patients. So nearing the end, important to mention the many programs that will launch very shortly, which will all include some kind of provision for digital health actions. So among these, of course, is the Recovery and Resilience Fund with a huge budget of over 670 billion, of which 20% is earmarked for digital, for use on digital, so deployment of clouds, infrastructure, data-intensive technologies, telehealth solutions, capacity building, and so forth. And 20%, as I said, is earmarked for digital. So if you can imagine, let's say 10% of that on health, it still comes to a very, very large amount for digital health. There's also the new EU for Health programme with a budget of around 5.1 billion euros. And this will particularly, of course, support the European health data space, infrastructure for electronic health records, as well as capacity building in health and care and interoperability and many other aspects. Of course, Horizon Europe will continue with its research portfolios in different ways in digital health technologies. And there's the new Digital Europe programme, which will have a budget of 7.5 billion. So we're waiting for the publication of the first work programme for the Digital Europe programme, but here's just an indicative idea of what it's going to support in terms of digital health. So many of these I've covered already so far, but as you can see in the first 2 years, because we're talking about the work programme for the first 2 years, there'll also be support for cloud infrastructure projects, for strengthening security and trust, and also for looking ahead for future technologies of promise, such as digital twins, and how we can support an ecosystem for these. And like I say, we're waiting for the publication of the work programme so that we can launch the first course later in the year and have the projects start as early as possible in 2022. So, thank you. This has been a rapid roll through of what's coming up from our perspective at the European level. Thank you very much for your attention.
Thank you very much, Ceri. Thank you for the excellent overview of exciting new opportunities in digital health and EU policies as well. We're all looking forward to the European health data space to make a real difference to patients, citizens, and for researchers to really be able to use secondary data. So we are now up to our last speaker, and it's my pleasure to introduce Sabrina Montante, who is here with us in Ljubljana. Sabrina is a senior policy advisor at the Italian National Health Service, and she's been the coordinator of the 2REACH project through Horizon 2020 funds, and she will speak to us about a new partnership on transforming health and care systems. Welcome, Sabrina.
So hello everybody, thank you very much for this nice invitation. I feel very honored to be here today. It's a very, very important milestone for the partnership on transforming health and care systems. We have just finalized a first draft of our strategic research innovation agenda. So this is actually the first meeting in which we are talking about this. So thanks for your presentation introduction, Maya. I want to highlight that today I'm here on behalf of the whole core group of countries that are working on the partnership on transforming health and care systems. Myself, in particular, I'm representing Italy with the Ministry of Health of Italy, but there are other countries that are part of this core group: Austria, Belgium, Switzerland, Denmark, Spain, Finland, France, Lithuania, Latvia, Netherlands, Norway, Poland, Portugal, Sweden, and last but not least, just in alphabetical order, Slovenia. So we'll move quite fast because I know that we don't have so much time, but I want to say just a couple of things about the partnership. First of all, the partnership are new approaches of Horizon Europe to joint actions in which different institutions work together to align priorities for more research. For those that perhaps are not familiar with this concept, we heard the presentation from the Commission before on Horizon Europe, but what was important for me to state that the partnership is a co-funded action in which member states and associated countries, together with the Commission, will allocate funding for more research innovation. So we are speaking about research now, and we are trying to tackle this issue from the research innovation perspective. These are the overview of the 49 candidate European partnership, and in light blue you can see the co-funded actions under Horizon Europe, and the first one in light blue is actually transforming health and care system partnership. So what is the state of the art? The partnership at the moment, as I said, just worked on the strategic research innovation agenda that will guide the future partnership in the next years. Of course, we will constantly update the strategic research innovation agenda, but this one will already be included in the proposal together with the first annual work plan. A first draft of this RIA, therefore, is now available and shared with member state representatives and associated countries and all participating countries for consultations. But the consultation is also involving other initiatives. And in fact, I'm very happy to be today together with other representatives from the European Commission representing also other programs, parallel programs that go to the same direction, because I think the partnership on transforming health and care systems can really serve, allow me to use this word, the work also done by other initiatives and vice versa. So let me see, perhaps I don't see. So just a little bit of background for you to understand. Countries already expressed their interest on the partnership back in October 2020, but now it's now time to develop the real proposal and actually provide the final commitment to the partnership. So we worked on the strategic research innovation agenda, as I said. Since we don't have much time, I think I'm going to highlight the most important things. I mean, first of all, the overarching challenges. I think that the challenges are challenges that everybody knows. We spoke about today, COVID-19, what is happening at the moment is clear. But I think that the challenges that COVID-19 is showing, I mean, there were challenges that were pre-existing, and in a way, they were not listened to much by the different stakeholders. Now they are actually listened by a wide range of stakeholders, so we really need to build the momentum to make sure that we make the change that was actually needed before. The challenges that we grouped here are the challenges of a changing population and society, the rapid growth of science and technology, and I want to make like very much a comment on that. This rapid growth of science and technologies, which required innovation also at service and policy level. We cannot think to just put in a context a new innovation without innovating also the organization beyond the service and the policy. And the public services need to act within environmental as well financial boundaries, so health systems within a wider system. This is actually a slide that shows you the gaps that we want to fill. As I said, the partnership will fill the gap on research innovation. We don't want to take, to actually reach the goal or really to improve health and care systems, putting really person and people at the center. We don't want to do it from all the perspective. We're not going to change ourselves, the health and care systems. But what we can do is really to align, pool resources for research innovation, making sure that the different priorities can be aligned, and making sure that we take the necessary steps to build the capacity and the skills of all actors involved, develop relevant ecosystems, context-based. That's why it's very much important that the European Commission on one hand, but also countries on the other hand, are involved with their institutions, but not only countries at national level, but also at regional level. The regional dimension is extremely important for this partnership, and the engagement of all actors, including patients. So this is basically, I covered this. I wanted just to highlight that we want to be aligned with the Horizon Europe mission-driven approach, really to bring tangible impact. And in fact, when we talk about research innovation in this partnership, we really mean implementation. We really mean link from research innovation into practice and into policy. We want to build an outcome-based and holistic approach in line also with international important recommendations existing. And last but not least, I want to clarify that we want to address the whole research innovation cycle. So research, but also innovation, and the involvement of enterprises working also with actors of the health and care systems from policy level, practice, and so on. So the partnership is not starting from scratch. It's the first joint initiatives in this field, but actually it's not the first action in this field. There were other actions before, projects like To Reach, the Active and Assisted Living Program, the Joint Program or Initiative on More Years, Better Lives, the European Partnership on Active and Healthy Aging. But in a way, what we want to do is overcome this fragmentation and make sure that we have one unique partnership, an umbrella in which all these actors can cooperate together. So, but it's important that in this regards, the partnership represents a very fundamentally novel approach in tackling this problem. Very quickly, the objectives of the partnership. What we want to do is really to intensify the cooperation for evidence-based policies, investment and sustainability. We want to strengthen and enlarge the research, innovation and practice community, and we want to improve the ability of participating countries and regions to implement innovation, so very much implementation oriented. And we want to increase the access to new improved solutions, make sure that when we work on new solutions, these are targeted to the needs of the population, and really help people to maintain and improve their health. The Strategic Research Innovation Agenda is highlighting different broad topics that are not new for the people working in this field. I'm not going to list all of them, but I mean, they're all known and interconnected. On one hand, the involvement of patients and people, the community-based, people-centered, integrated care, the health and care quality and safety, health and care workforce, digitalization, everything that has been mentioned today and yesterday. We made a decision not to choose one topic other than the other because we consider all of them interconnected. What we're going to do is to tackle them through an annual work plan in which we will identify the priorities based on the policy needs, considering, for example, emergencies as well, like, for example, the COVID-19 that everybody's living and the need coming from that. But really, what we've done is identify priority actions to respond, to achieve the objectives that I previously mentioned. So all the activities will need to go towards this direction: integrate research innovation findings in evidence-based decisions in health and care, generate and translate, finally, research innovation finding for innovative health and practices. There are projects that have done that. Let's make sure that these projects are, in a way, put together, and we focus on the need to transfer this innovation coming from all these projects and this initiative across Europe, and not only Europe. Advance the co-creation and uptake of user-friendly innovative solutions in health and care sectors, and strengthen the health and care community for a sustainable dialogue among the different actors. So the partnership will be around mailing through funding of the calls. So as I said, member states will allocate funding and will do that, and the Commission will participate with a co-fund, indeed, up to 30%. Back in October, the commitment of the countries was quite high, so we were very happy of that. I say we, I mean in the core group of countries that were really committed to this partnership and working on the proposal. As I said, the Strategic Research Innovation Agenda will guide the partnership, but priorities for the calls will be decided through annual work plans. And action supported implementation will be envisaged using different instruments. So the funding, but also some in-kind activities done by the partner of the partnerships that will be made mainly by funding bodies, but also by ministries or by other research innovation actors important for this partnership. One thing that I want to highlight is that this is an occasion really to have a Ministry of Research, Ministry of Health, funding bodies on research innovation working together. Last but not least, this slide is a little bit of colorful, but it's very important for today because we have this partnership is not running alone. As I said, is looking this from one perspective, but synergies will need to be developed and foreseen in the design and planning of the partnership. We have done meetings with the Youth for Health program, Digital Europe program. More meetings we would like to organize more meetings to discuss really the priorities, because as I said, what our intention at countries at least is really to make sure that we don't duplicate efforts finally. Synergies in the implementation, so when the partnership will be running, we will need really to make sure that we are aligned also with the other partnerships in Horizon Europe, and not only because in a way health and care systems is connected to all of them, because everything is translated into, all innovations are translated in health and care systems. And the synergies in the funding, because we can really explore the existing funding opportunities to make sure that we optimize this funding, also at the regional level. I heard that was actually mentioned that. So the presentation is ending. The call text is now in the work program. Now we are in the consultation phase. So we are, with this consultation, it will be ending in 31st of August. After the consultation with all member states and associated countries and interested countries in the partnership will be finished, we will then incorporate possible useful comments into the new strategic research innovation agenda that will be finalized in autumn 2021. In parallel, we will work on the proposal that we will submit in spring 2022. And if everything goes well, the partnership should start in January 2023 and run for 7 years. Thank you very much.
Thank you so much, Sabrina. We've run out of time, but I hope that we can. I can ask you just a very quick follow-up question that we received on the chat from Thomas Alvin. How are you planning to ensure that there is a link between the new innovative health initiative that Irene mentioned and the partnership on health systems? And maybe Irene, you would like to also come in on that very briefly. So I give the floor quickly to you, Sabrina. Yes, okay. You start.
Well, we are already thinking about the synergies with the innovative health initiatives. In fact, we have organized a meeting with representatives from the Commission that are working on the innovative health initiatives. They worked on the strategic research innovation agenda as well. So what we are doing is actually working to see how we can comment the document, and we ask them also to comment our document. This is for now. Now, in the future, what will be important is that we really try to see sustainable mechanism for constant exchange between the different initiatives. I think it is something that innovative health initiatives, which is in a more advanced phase, is already considering, and we are also, as member states involved in the partnership on transforming health and care systems, we're also doing that. We are just in a less mature phase.
Irene, do you want to come in? And also, I don't know if people can see, but there's a fantastic illustrator here who's done these wonderful portraits with some key messages. So I hope that the audience can see it. Irene, I hope you can see it, because it's a fantastic one of you. Please, Irene.
Yeah, indeed, I can see. They are fantastic and really capture, I think, our personalities. I'm really happy with that. So indeed, I think the benefit is that each one of these partnerships also work on annual work programs, which make sure that we also can ensure the synergies between the different partnerships. I didn't mention, because we also have a partnership on personalized medicine, which is already up and running, that also will sort of continue a little bit later on in Horizon Europe. So what's important is indeed to make sure that if there are innovative solutions developed in one partnership, we should see the synergies with the other partnerships, if that could be. For example, if we take something in the Innovative Health Initiative to be developed in terms of, as I explained, to put together all these different technologies into a product, we can then see with the health systems partnership if there could be research also done in parallel with when you develop, how to put this together in practice, how would that look like then in the health systems perspective? So I think this is really important that we look at in general, how we can do the best use of the different tools that we have. Now we talk about partnerships, but we also have the collaborative research projects. We have the European Innovation Council, a European Research Council as well. And I think that this is really important, that we look at where we have innovative solutions coming from anywhere, how can we make sure that they are best taken up into the health system, so when that would be relevant. So I think this is something we need to put together a very sort of solid systems in terms of catching the novel innovations and see how they can then be brought up. And I see Adrian is also maybe would like to comment here, because we also have the EU for Health program, and here we need to look at this ecosystem and how we put this jigsaw together. But the good thing is that we are all working together, so we are not working in isolation, and this will be the key here, to really bring together the different results and to make sure that they can be deployed in the best possible way.
Adrian? Oh, one minute, Adrian, would you like to come in?
1 minute. Thank you, Maya. Thank you, Irene. Yes, indeed. I think we need to collaborate closely, and I would like to pick on the technological pool that Irene has mentioned. I would emphasize there that we need to talk about innovation pool, because innovation is both technological and non-technological. And I see Irene nodding, and well, I think under EU for Health program, what we can do is innovation rollout. That's something we can do, and certainly we need the evidence that is developed by the Research and Innovation program, and we will be carefully looking at previous results. That would be all from my side, Maya.
Okay, well, thank you very much. It gives me the nice task to thank all of the speakers for your interest, your enthusiasm, and for sharing with everyone so much that is coming in the pipeline. For me, I have 3 words that stuck with me. One is partnerships. We're seeing that this is really a new mindset, the way we're working. Synergies, of course, and then innovation. And I think together, by putting all of those 3 together, by raising awareness in types of meetings like this, hopefully we can all work towards finding these innovative solutions for the resilience of health systems. So thank you very much, and I look forward to the next sessions. Goodbye.
So, ladies and gentlemen, welcome again at our conference. We're heading towards the highlights of our 2 days of gathering. First, the strategic, the way forward, the ministerial roundtable, and then, of course, the statement by Mr. Mario Monti. Well, the ministerial roundtable will be moderated by an expert, Mr. Josep Figueras, Director of the European Observatory on Health System and Policies.
Hello, welcome to this last panel today. Key panel indeed, because we have a panel with 4 ministers. That has been said will be followed later on by our keynote speech by Professor Mario Monti, and then the conclusions of the conference. First of all, I'd like to welcome our ministers. Indeed, Janez Poklukar, our host minister, Minister Spain. Thank you very much for being here. It's a real privilege to have you here live in the studio in Ljubljana. And at a distance, I'm very, very happy and pleased to welcome Minister Temido from Lisbon and Minister Speranza from Italy. Welcome all. Ministers, you'll be very happy to hear that your staff, your colleagues, staff of the Commission, has been working very hard these days, and we have lots of progress during this conference. We heard a lot about the priorities, the priority areas of your member states, of other member states, to strengthen resilience as a response to the pandemic. We heard a lot about best practices and lessons, particularly for implementation. This conference is about implementation, it's transformation of organizational innovation and reforms. And we learned that in spite of the huge differences between the member states, in spite of the different contexts, there's a lot in common that we can learn in the process of change. Lots of lessons there. And in particular, we learn about how to use more effectively the range, the richness of new instruments available within health programs, but outside health programs, to support health systems in the EU of ours. But what would we like, ministers, for this session today? We'd like to hear your political perspective. Particularly want to hear about the way forward. Where do we go from here? We are aware that there's a political process in which the capitals will be consulted, will be working closely with the Slovenian presidency to talk about the council recommendations. There is the informal council. There are a range of mechanisms for you to agree on these political priorities. But if you were willing to give us a bit of a taste of what's in your mind today, of how you see us moving forward. There are 3 sets of general questions we posed to your cabinets. We talked in advance of that for you to consider. The 3 are the usual one, effectively. As we rebuild after the pandemic, as we strengthen the resilience of our health systems, what kinds of priorities you have in mind, not in mind, but in practice, and which one of those are really key to collaborate across the EU member states. We like very much to hear about the proposals of the presidency. Our presidency wants to hear whether these proposals are in the right direction, how we strengthen these mechanisms, how we make them work even better, how we may want to develop new mechanisms, you may want to develop new mechanisms, and as I said, on the way forward. And that's perhaps a question I'd like to also reserve for our panel debate at the end. Ministers, it has been said again and again and again, it's almost ad nauseum, that the COVID crisis has reminded us that we cannot stand alone. We are in the same boat. Either we work together or we sink. And COVID has been a strong reality, frankly, that we knew from prior crises, but this one has been even a stronger reminder. So, how the EU can help in this boat together? How can the EU help each other in navigating together? And in that, I think our participants, our audiences, our citizens are asking us, it came very clearly yesterday talking about the lessons, strong political commitment, a strong political commitment for change, for transformation in your member states, but also at the EU level. How we're going to do that is as follows. We will start first with the two recent presidencies. We'll start with Mr. Span first, and then with Minister Temido from Lisbon, discussing some of these questions, and then we'll be followed by Minister Speranza. Speranza, Italy, has just held the G20 presidency, is holding the G20 presidency, and it's actually a powerful reminder, this is not about the EU alone, it's about the regional office of Europe, is the broader Europe, but it's also broader than Europe. The G20 is looking at international governance issues. There are no borders anymore. So I think it's a signal there that we need to talk not only within the European Union, not only within the wider Europe, but also across the globe. And there are many initiatives that Professor Monti will be telling us later about international governance, part of the Commission. He's been leading the Pan-European Commission. Finally, Janez Poklukar will reflect a bit on what your fellow ministers are saying and how you take that forward with your presidency. So, to make it more entertaining, as we didn't want to have sort of talking heads one after the other, particularly in Zoom, we're going to make a mix of statements, question, answer, and then at the end we'll have, I hope, a very active chat box where we get lots of questions for our ministers at the very end. Which reminds me that I should stop talking and give the protagonism to those who really have the protagonism, the leadership. Mr. Span, first of all, our sincere, deepest condolences on behalf of all of us, of the floods, of the deaths that Germany is suffering. It is actually a very powerful reminder of externalities, of the externalities of climate change. If I may say so, Mr. Span, you are at the leading edge on measures to fight climate change, and yet you are suffering the floods. Health is the same thing. Health is exactly the same thing. It has powerful externalities. It's a powerful public good that we have to work together, regardless of us having our act together. If we don't have our common act together, we are not going to succeed. So, Ms. Span, I understand you have a first statement, and we ask you the three questions I actually am asking for the audience, I'm asking for all the ministers, which is about what Germany is doing, is putting in place the priorities to strengthen the resilience of its health system, and which one of these areas you are happy to collaborate with all member states. We like to hear you talking a bit about the initiatives of the Slovenian presidency in this field that has been presented these days. And finally, as I said, moving forward, Germany, in your presidency, emphasized the importance of increasing cross-border cooperation. That's one of the areas that you were leading, pushing forward. So how do we move forward, Mr. Span? The floor is yours.
Thank you very much indeed. And first of all, thank you very much to all of you for the condolences, for the compassion. It's very much appreciated, and it's very important for our citizens to know in these difficult days that they are not alone. and that we are together in this, especially those who really do suffer these days, still searching actually for relatives or actually that have lost partners, children, parents. So we are with them, and thank you very much for this. And as you mentioned it, externalities. I mean, we have a century catastrophe, this pandemic situation, and this is a very extreme event too, and it shows actually how important it is to avoid and to prevent and to prepare in case it happens, and that counts for health too. And so I'm very grateful, Janez, that your presidency is starting with this conference on resilience and actually starting the lessons learned process. I'm very happy that Marta from Lisbon and Roberto from Rome are with us too. Good to see you again virtually. Hope somewhere we all can gather again, and that the situation in our countries makes it possible that all of us can gather again here. But for the topics you raised, actually, one general remark. What we have learned in this is that, you know, I'm one of those in the German debate that always said, when it comes to health, there should not be an automatism that Europe has a responsibility to. It really depends on what we are talking about. And there are some responsibilities that need to remain on a national and even on a regional level. But obviously, there are areas where there is a European added value of cooperation and working together, which is research, rare diseases, for example, Horizon 2020, 21 now, and for the 20th centuries. Vaccine research, by the way. Imagine a world where only Russia and China had developed a vaccine. So it's very important that we cooperate in all these areas. Fighting the virus, infectious diseases, virus knows no border, no matter which virus. So it's important to cooperate in that field. And so there are certain areas of health policies where there is an added value of cooperation in Europe. And we should focus on that areas. And that's what I keep on reminding the Commission and will keep on, not to interfere everywhere, but to focus on these areas. And I just want to mention three when it comes to resilience. One is, I was just in Geneva yesterday with the WHO, and one important, and for the G20 too, one important actually goal we have, it's one of the Sustainable Development Goals, is universal health coverage. And what really makes a healthcare system and a nation, a society resilient in case of such an extreme event like a pandemic situation is just a working healthcare system, primary healthcare system especially. I was in autumn 2019 in East Congo during the Ebola outbreak, and you could see without the ability to just deliver, with no doctors, no healthcare workers in place there, and no primary healthcare system, it's very hard to really tackle any of this problem. So actually, first of all, we do need a primary healthcare system and universal health coverage in Europe too, in the European Union. Professor Monti and I just discussed last night actually how much, I mean, primary healthcare system and universal health coverage needs funding. And we have some debates, of course, especially within the Eurozone, about sustainable financing and budgets. So do we see the costs of the healthcare system as costs only, or do we see them as investments too, in resilience, for example, and in preparedness? So that's one important topic for our debates, and to actually link these two debates of financing and funding to the question of what kind of at least primary healthcare system, universal health coverage we want to achieve in the whole of Europe, and what can be financed, by the way, with the EU Next Generation program right now to build this up. Second, what we have experienced, at least in Germany, is regarding digitalization, we still were in the 80s in the health system. I mean, the rest of the country, of course, in many, many areas, there's digitalization all over. But in the healthcare system, I mean, the fax sent from the labs to the local health authorities, it was just still there. March last year. Meanwhile, we have digitalized it. Meanwhile, we have started the electronic patient record. Meanwhile, we have managed in Europe together to have the digital certificate for vaccination, for traveling. But that was a real boost to digitalization in the healthcare system. But of course, that's not yet enough. And that can have a European added value too if we share the data, for example. And that is why with our presidency, we have started the debate on the European data health, health data space to have a common framework of the 27, how to deal with the very sensitive health data, personal data, actually, and that everyone actually can rely on a common framework for health data within the European Union. That makes the system more resilient too, because that makes, for example, research easier. And that brings me to my third and last point, which is actually this dependency we have experienced. We are too dependent on other regions of the world. I mean, there's this famous example we all had to experience of the masks, that 80% of all masks produced worldwide are produced in China. And back then there was just a World West market. And it was very difficult to get any. And it's not just about masks. I already mentioned, imagine a world when in which only China and Russia had developed a vaccine. So you would never give up on defense industry and just give it away to China or Asia because it's cheaper. You would always keep it within the European Union just for security reason, for good reason. So when it comes to health and health security, we obviously need to become more sovereign in research, in building up production capacities and just have them in place, even if there is no pandemic ongoing, just to be prepared for vaccine and drug production. To have mechanisms like we have developed them in the finance crisis 10 years ago. Actually, the finance minister back then, they had no mechanisms to have quick decisions. And I remember very well at the very beginning, Roberto and I had a lot of calls with each other, Marta and many, and now with you too, since you entered us during this endeavor in the office. We had no mechanisms in place, emergency mechanisms for health threats, and that needs to be changed too, and for that we need European institutions that are strengthened. And that is why we are very grateful that together with the Portuguese and the Slovenian presidency and the Commission and actually all member states and the Parliament, we really put all efforts in now to reform and strengthen ECDC, EMA, to build up HERA like the US border, to be more flexible in acting and reacting. So that is building up resilience through building up institutions that are able to act when action is needed. And all of this, actually, we have started during the pandemic situation, and we are not just discussing it and not just having declarations, we are really implementing it already by, for example, legislative acts. And that is, again, why we are very grateful that the Slovenian presidency is taking these issues up and is really committed, and you can feel it, to bring it to results.
That's absolutely beautiful. Thank you very much indeed. You talked about the need to collaborate, the public goods of research, the public goods of the viruses, of the NCDs, or the communicable diseases rather. And you mentioned universal health coverage. I wonder, Mr. Spahn, there is an externality also in ensuring that the rest of the world, global health is an area that the EU is playing an important role. I was very happy to hear that you're in Geneva and they are pushing within the EU this idea of global health, because ultimately UHC, well-being in other parts of the world, looking at selfishly, will affect us. And you'll remember the refugee crisis, one of the shocks in which actually member states had to come together not that long ago, and earlier than that, the financial crisis. Don't you think that externalities goes a bit beyond sometimes of the viruses crossing borders? Wouldn't you think that some of this universal coverage is an externality as well, that member states need to support each other and support other middle and low-income countries.
Yes, of course, definitely. I mean, that is why we are so much engaged as Germany, but as a European Union too, and the European member states to our work within the WHO. I'm very grateful actually that we have managed to find a common position of all 27 to WHO reform and actually the priorities of WHO. But that needs funding too, by the way. If we actually define together what WHO shall deliver when it comes, for example, to universal health coverage, to help countries worldwide to build up resilient health systems, they need the funding. And so actually walk the talk. We really need to make that difference too. But I'm very happy that actually we have this common sense within the European Union, how important, and with the G20 now, the presidency of Italy, the G7 presidency of the UK, next year Germany, we have the chance to actually coordinate all these international fora and to really push these issues, and again, not just by declarations, but by implementation.
Exactly. Walk the talk, put the money where the words are. And you said, Minister, interdependence. Interdependence is in our hearts and our minds today. I'd like later on, we'll have a discussion about whether there's a space or we should go further in those initiatives together, but we'll leave that for the debate later on if that's okay. Let me now bring from Lisbon Minister Temido. Thank you very much, Mr. Temido, for being here. We have a number of questions for you, following very much the debate, the discussion we had with Mr. Spahn just now. First of all, we heard that several times. COVID-19 has been a breaking point for many of us. What is your perspective from Portugal? What are the kinds of priorities that you're putting in place? We heard from Germany about digital health. I believe that's an area very important for you as well. What are the kinds of priorities you're putting in place, Mr. Temido, and which one of those you think are particularly important to share across our EU member states and learn and collaborate with each other?
Well, good morning. It is a pleasure to address you today. First of all, I wish to thank the Slovenian presidency for the invitation to speak to you, and I apologize for my virtual setting. I also want to offer you my best wishes for the semester ahead, dear Janez, and I am sure Slovenia will carry out the presidency's task with efficacy and success. Turning to the subject at hand, the way forward in implementing innovative solutions for resilient health systems and about Portuguese priorities. I would like to stress that Portuguese National Health Service is designed to ensure access to all who need it, including the most vulnerable sectors of the population. It is a universal health coverage system which aims to provide a broad range of services free of charge at the point of use to those living in Portugal. It is our understanding that the resilience of the Portuguese National Health Service may best be improved by the employment of an integrated response capable of strengthening the capacity of the system to respond to demographic and epidemiological changes, as well as therapeutic and technology innovation. Promoting the use of digital tools has been and will continue to be, of course, key in ensuring equitable access to the provision of health services while guaranteeing the system's financial sustainability. The success of these reforms will, of course, depend on the continuous implementation of innovative solutions that promote a people-centered health system based in the integration of care through a three-pronged approach. Firstly, we must integrate all levels of care from primary care to hospital care and long-term care and palliative care. Secondly, physical health and mental health must be treated as a whole. And thirdly, we must promote a better articulation of health and social services. Furthermore, Portugal's reform and resilience plan focused on resilience, climate and digital transitions, and includes structural reforms to the National Health Service. Strengthening healthcare, especially primary care, will contribute to an increase in social cohesion, guaranteeing a more equitable access to healthcare services by the population, all the while increasing the system's resilience to avoid and mitigate the effects of this pandemic or future ones. Additionally, I think that expanding and diversifying our primary care response is considered to be the most inclusive, effective, and efficient way to protect the health of the population. This is, of course, a logical conclusion, since primary care addresses the challenges associated with natural occurring demographic changes, such as the aging of the population and the epidemiological changes. Primary health care is also an essential step in our approach to reinforcing the system's response to the mental health needs of the population, a challenge that is also under the table. Other reforms to primary care have focused on improving healthcare access, namely by ensuring that a higher percentage of the population is appointed a family team made up of a general practitioner and a nurse, family nurse. Moreover, certain policy options, such as granting undocumented migrants access to healthcare or eliminating certain user fees, have created numerous benefits to often sideline sections of the population, and this is also a way that we want to work forward. Thank you.
Thank you very much, Minister Temido. It seems that our member states are singing from the same music, and this is beautiful to hear. A lot of emphasis on digital health, a lot of emphasis on primary care. Music to your ears, Minister. Slovenia has been together, actually, with Portugal, one of the countries with better primary health care in our region. And lots of emphasis, Marta Temido, Minister Temido, on inclusion. We have 3 eyes in this, 4 eyes actually in this conference. We have investment, we have innovation, we have inclusion. You put a lot of emphasis on this eye of inclusion, and of course we have the one on implementation. So let's talk perhaps a bit more about that implementation. As we look forward towards the future, Mr. Temido, would you dare to tell us 2 or 3 most important lessons you have learned about strengthening the ability of our health systems to respond not only to this pandemic, but to, unfortunately, new shocks that are bound to happen to our systems? Minister. Did you hear my question?
Sorry, yes,
should I repeat it?
Thank you, Professor Figueres. Looking to the future, when we think about the way forward, one particular term comes to my mind, and it is information. The rapid spread of the pandemic was, in part, due to the lack of effective communication between different health systems, an overall lack of information about SARS-CoV-2 and COVID-19, and a subsequent spread of misinformation across member states. Indeed, engaging people for change and better decision-making at all levels is crucial for more resilient health systems and societies in all stages of the called shock cycle. An author said that in the next influenza pandemic, be it now or in the future, be the virus mild or virulent, the single most important weapon against disease will be a vaccine. The second most important weapon will be communication. So health literacy must therefore be on the forefront of our policy making in order to prevent the spread of misinformation, such as the one we experienced during the hardest phases of the COVID-19 pandemic. The pandemic has further shown us that surveillance can play a key role in response to public health threats, Having an integrated approach can provide real-time detection and enable a more effective deployment of the available resources. The ECDC has already proposed an epidemic intelligence solution that includes both indicator-based and event-based surveillance, allowing member states to both share and be privy to update epidemiological information. So this is the way forward that we think that is important to walk through.
Excellent. I think, again, clear convergence, clear need to work together between member states on information, on data, on strengthening this European Health Union proposals to strengthen the ECDC, and a lesson that you ministers learned the hard way. You already know that lesson, of course, which is communication, communication, and communication for COVID has been the key, most important, indeed, lesson. Mr. Temido, however, as Mr. Span told us, we have to put the money where our words are. So in terms of investment, what are the implications of these lessons for investing? Where should we invest? Where should you invest, member states? Separately or together? We're talking here together through the EU.
Together, of course. We think that overall the lessons we have learned should pave our way forward, and in that sense, we must recognize that long-term and continuous investment in modernizing information systems really pays off. When the pandemic started, Portugal already had a digital vaccination registry and lab-based surveillance that proved to be fundamental to have near real-time information. In order to pave the way forward in this issue, we should aim to reinforce the investment in data systems that provide near real-time information, support high volumes of data, and are resilient to attacks. We will still have a long way to go to achieve interoperable systems at a new level fit for epidemic preparedness, of course. Telemedicine is on a journey to becoming more and more useful. The pandemic was and is a significant driver to increase usage and access to telematic technologies. Investing in the adoption of mass services, not only in the pre-pandemic niche for telehealth, will be a significant challenge for the next decade. The EU has a significant role in providing the right incentives to shape public and private policies. And finally, the primary enablers of all those changes are healthcare professionals. We must continue to invest in having a qualified and prepared healthcare workforce.
Perfect. Thank you very much indeed, Mr. Temido. Very, very clear priorities. The last one came a lot during our discussions these days on human resources as well. As we have an internal market with free circulation of patients and providers and doctors and health workforce, we need to coordinate, we need to plan together to a large extent. Let me now move to Rome and welcome Minister Speranza to our meeting today. Thank you very much. We're particularly pleased as well to have you here, highlighting again the G20 presidency and the coordination, the chiming, as it were, of messages between the EU and the G20. But we have a number of questions as well, Mr. Speranza. But let me first ask you whether you wanted to address us, I believe, with few words.
Yeah, thank you very much. I'm very glad to be with you today. Thanks to Janez for organizing this high-level conference, and thanks to Marta for everything she has done in these difficult months. And let me say to Jens that we are very close to Germany for what's happening in this moment, and to the families and the victims. And we are very close to you, Jens. Yeah, I think we have many lessons from these awful months. We became, we can say, good friends with all the other ministers, because we we have to deal together with the same problems day by day, week by week. And I think that we know very well how difficult these days have been. I think that there are three main lessons. First one is that there is a great strategic relevance for our healthcare system, and we have to invest more. I think that this is the first lesson we need to remember for the future. More money on health systems. Money we put on health system is not only a cost, but is the biggest investment on human life. This is my opinion. The second big lesson is that we have to be better coordinated. We are doing a lot, we have done a lot in these months, but we still need to do a lot more. We have to coordinate each other because health is an international issue. And this is the third lesson from my point of view. We should not never consider health a national or even a local issue. It has to be considered an international issue. And this means that we have to invest all we can on international institutions. We need a stronger WHO, reformed. We need a stronger SCDC. We need a stronger EMA. And we need, of course, stronger coordination between the European countries. This is, I think, our point of view, and I will do my best to bring this spirit and this work to the G20 meeting. It's an honor, a pleasure, but even a very big responsibility to lead the G20 in such an important moment. I think that G20 is always important, but G20 of the Ministers of Health in Rome at the beginning of September will be really an important moment, because we have to learn from the lessons and think about the policies in health for the next years. And I think this is something very, very strategic and very, very important.
Thank you very much indeed. Thank you as well, Minister, for this strong political commitment on investing in health systems. I'm a child of cost containment years. I'm a child, meaning professionally, of course, an academic and analyst and director of the Observatory of Cost Containment. I'm not saying that, and we said that yesterday, ministers, we're not talking about waste, we're talking more efficiency than ever, but we are recognizing the importance of putting more resources in this area of health. Also, thank you for the powerful message on inclusion and the powerful message on working together internationally and in Europe through the ECDC, the EMA, ERA, and all these new mechanisms, new institutions that the European Health Union Initiative is putting together, thanks to your support, thanks to your leadership. Mr. Speranza, can I discuss further the G20? The G20, we already announced many times, Professor Monti, you've been announced many times for your keynote speech later on. We've been talking about a lot about that's not European Union, that's not Europe, it's well, well beyond. And I know that Italy, in its meeting, in the Global Health Summit in Rome, has been talking very much about the issues that affect G20 and the globe as a whole. Could you tell us a bit more what are the objectives of Italy, what are the objectives of G20 in terms of broader collaboration between G20, between the globe effectively to deal with these broad externalities, health externalities we've been talking about?
Yeah, it's a pleasure for me. What I was saying before is that we think that this G20 is very important for the moment in which it arrives. It's a G20 during an epidemic. We see the numbers of these days in our countries. Numbers are again growing, and we have to work together and to do everything we can today to fight against this epidemic, and of course to become ready for the next epidemic. I think this will be very central in our meeting in September. As you know, we have done a lot of work in these months all together within WHO, within European Union, with the CDC. And what we think is that G20 will be another moment in which we have to do another step in terms of making stronger our cooperation. As you know, we have had in Rome the Global Health Summit with our leaders, and that was a very important moment. And we will try to emphasize and make even stronger the themes of that meeting. We deeply agree, for example, with the proposal of President von der Leyen of a Union of Health. We strongly believe that we should find a stronger mechanism of international cooperation between countries in G20. I know that Professor Mario Monti is doing a great job on this field, and we hope that Italian G20 will try to make even stronger this kind of proposal. Of course, the other main issue of our G20 will be try to answer to a great question we have. What can we do now against COVID, and how can we help all the other countries? Because as you know, G20 is a part of the world, but is not all the world. And what we really know now is that we will win against COVID only when every country will have won this fight. That's why we have to work all together. We did something in the G7 meeting, we did something in the European Union meeting, of course, but we want to do more in the G20 to try to invest on the opportunity to give vaccines to all the world. My personal opinion is that vaccine should be a public right of everyone and not a privilege of the richest countries and the stronger countries. That's why we have to work to do everything we can to give the more opportunity to have a vaccine for everyone. So this is what we are doing in terms of planning for this important meeting in Rome in the 5th and 6th of September.
Great, great music to all our ears that the G20 is committing so much in this very important field. Mrs. Pranza, Mrs. Span, an area that affects both of you, and I'd like to take, hopefully we'll have time during the panel debate, is the regions. You have a federal structure, both countries, that affects other countries such as Spain, my own country, or the Nordic countries. And I'd like later on, even if it's just a question that does not get answered, how do we get this federal structure working also with the EU? What's been your experience in Italy? Very rich experience. In Germany, very rich experience. The federal level with the landers, with the regions, with the lenders, with the regions, and how you work together for such a crisis as the pandemic, and how also you coordinate that direct exchange, direct collaboration with the European Union institutions. But I'd like just to park that one for later because I think it's key and central to our debate today. What I'd like now, if that's okay with you, would be to move to our host minister and ask our minister some reactions. Are you happy, Minister? Are you happy with what you heard from your colleague ministers, the statements? Does that chime with what you're expecting to hear today when we were preparing for this presidency?
Thank you, Mr. Figueres, for all what you did these days and for this conference. I must also thank you, Roberto, Marta, and Jens for participating in this conference and share with us their vision, and in such a way we also strengthen our cooperation, and I believe in stronger Europe. But I would like also to say, Minister Jens, that in these tough days German people have support of Slovenians and I believe all European citizens, and you can count on us. Then if I'm return back to our debate, I'm very happy that I can say that we have common challenges. We talk about digitalization, then long-term care, primary health care system, mental health. And we all have not just same challenges, we all recognize these challenges as priorities, and I think that's important. And I also think that pandemic is a big opportunity on which we can strengthen not our health system but our collaboration. And I believe that at the end, as a result, we will have stronger not European Union but the whole global health system. On one hand, we will have to face with COVID-19, with the fourth wave in the autumn, but on the other hand, we will have a problem with healthcare facilities, with all inpatient and outpatient services in healthcare system, which we'll have to do, and they didn't were made in the past, in the time of COVID-19. And here are two tough challenges for all of us. And today we talk about, on one hand, an epidemic, which will influence on our healthcare system, but on the other hand, we know that more than 95% of needs of population is out of pandemic and COVID healthcare problems. They are our usual problems, and COVID-19 pandemic is also an important opportunity, because in the last years we always, I don't know, last 10, 20 years, we all the time talked, there's no money for healthcare systems, there's a lack of resources, but I think that in the next few years we will have all. There's only a question if we'll take this chance and really build this more resilient healthcare system. And this conference is opportunity to search a way how to do it.
Indeed, indeed, Minister. Thank you very much. Talking about your own presidency, Minister, what's been your experience using these EU support tools, these mechanisms? What are some of the lessons? In many ways, you already integrated those lessons with this beautiful program, this work you've been doing. But give us more of sort of a granularity. What's your experience using these tools, these instruments over the years?
The basis of our healthcare system is certainly primary healthcare system. And like said Marta, we have to even more put more effort to strengthen our primary healthcare system, because in the time of crisis, primary healthcare system was as a buffer not inside of healthcare system that we go through this pandemic, but also the buffer in the society. Because if the healthcare system would fall, then the society would fall. And this is very important. And in this moment is very important from the eyes of presidency of the EU, that we have to strengthen EU health and all three legislative package documents are the basis for better preparedness for the next crisis. And we really doing really hard with support with Janez, Marta, and also Roberto. And I talked with my colleagues in Brussels today, and they are even today pushing really hard on these documents. I believe that this is a good basis that we will continue and make strengthen our healthcare systems.
No doubt. And much of what you're putting in the presidency, in the practical, more effective use of these instruments will help that an awful lot. But let's move on now a bit, which I will use that as a basis for the debate. Where do we go now, Minister? What is the way forward? Certainly, there's been progress. We now see how these instruments can be used. There'll be a number of suggestions. You'll present a number of suggestions from your presidency of how using them more effectively. How do we move forward? What are the next steps there, Minister, that you see pushing?
The most important thing at this moment will be to involve as fast as possible, because we will have enough resources, I think that funds will give us enough money, we will have enough all resources, but the question is, will we be enough fast to prepare our healthcare system for a next crisis, because we are at the beginning of the next wave. So this is a very important view, and innovations on which we are talking these days are very important, and not because on one hand it's very important that each of us don't go and have a pilot project and try to find something new, but we can help each other and give our knowledge, and so be quicker in this when reaching these goals. That's certainly important thing. And other is also how to transform our healthcare system in more resilient healthcare system. One of these steps is certainly digitalization, and we know that each of us have knowledge on some part of digitalization, and all together we will be faster on this route to get our main goals.
Perfect, thank you. So, more of the same, but faster, more resources, and more emphasis, Mrs. Pan, as you are here today, more emphasis these days has been on the transformation, on supporting that process of change, of the introduction of innovation. Let me now move us to the chat. What is the chat been saying today? Hearing all that. Also, not only today, but these days, yesterday and this morning, that would be relevant for this session. Shall I invite Dimi Pantelli to come on board now from Brussels to tell us a bit more what's happening, what people are saying, what are the points we're hearing from our audience today?
Hi, Giuseppe, good afternoon everyone from the European Observatory in Brussels. We don't have a very active chat, or not as active as we would have hoped, and I think probably now is the chance for colleagues who are participating to voice their questions or their input for the remaining of the session. What we do have, however, is a message from the Ministry of Health in Spain, because colleagues could not join us today, but they did send along their priorities for the recovery of the health system and for ensuring that the Spanish healthcare system is as resilient as possible moving forward. And if that's okay with you, at least for now, before you move into the debate, I will just point these out and then come back to you, Giuseppe. So I think what we see from the Spanish colleagues is very similar to what we have heard from ministers today, and what we have heard from participants and other speakers over the past 2 days. The first point is that these extraordinary funds that have been made available will be a big help to strengthen and expand the capacities of the national health system. There are three rather main areas of focus. The first one being reinforcing the diagnostic and assistance capacity of the health system, primarily by modernizing high-tech equipment. And we heard about this a little bit today, but also yesterday. And the ministry will actively promote projects that improve the digitization of the national health system. So chiming in with what other ministers have been saying today, quite a big importance of digitalization moving forward is a clear lesson from the pandemic. And then finally, that the government of Spain will promote collaboration projects with all public administrations for the improvement of the national health system, highlighting here again the point that was made also previously in the panel, the importance of intersectorality and working together within and across countries. So much from our Spanish colleague. I apologize in advance, my Spanish is not great, so maybe I misinterpreted one of the nuances. But I would now come back to you, Giuseppe, for the panel discussion, and if we have additional input from the chat moving forward, I'm happy to come back.
Perfect. Thank you very much, Dimi. Actually, we are running out of time. We start a bit late due to a press conference, and we have some limits, I think, I've been told, with some flights that they may be departing. But let me try one question to all of you ministers, and if that's okay, I'll give you 1 minute each. We're used to sharp answers and direct answers. And we'll have a last round, and then we'll see our cartoonist, how our cartoonist has interpreted not only your faces, but also your points. We'll have that at the very end, Let me try this question to all of you. We talked ad nauseum that COVID-19 has changed everything. We talked about, which word am I looking for, colleagues, not colleagues, ministers? Pooling, sharing sovereignty, adopting shared governance mechanisms, stronger collaboration. What's the word that reflects that we really do need to collaborate, to work together? And we do acknowledge that certainly the Resilience Fund and Recovery Fund has been really a way forward. The U4Health program are key. So the money is close to where the words are. Is this enough? This is my question to you, ministers. Is this enough? We do realize we need to work together, but we've been saying that for years. Let me try one for you, ministers. AMR, antimicrobial resistance. I had the privilege to moderate the conference of the EU Presidency with Ministers of Health, Environment and Agriculture a number of years ago on this subject, as well as the Romanian one. And we were reminding each other that there's Council conclusions and recommendations and plans since the year 2000 from the Commission and certainly from WHO. Member States have done fairly well in this region in adopting One Health Action plans. But would you agree with me, ministers, that you haven't been that good, if I may? I'm nobody here, I'm the observatory. We haven't done that well in sharing that governance, in working together, in perhaps regulating a bit better, because if the neighbor doesn't regulate for use of antibiotics, it doesn't matter how well you do it in your country. And AMR was predicted by many as the big pandemic. COVID came first. Do we have enough with the steps we have? Should we go further? The regional director yesterday was calling for a radical, disruptive rethinking of how we do things at national level, but also perhaps at European level. Are we happy with what we got? Do we want to go further? Mr. Spahn, you are the first one to speak, so we'll start with you and continue with the same order for these last reflections.
Well, I mean, of course you are not wrong, which means you're right.
Diplomatic, beautiful answer.
that there are, I mean, I remember very well to have even a bigger one, the Lisbon strategy 20 years ago, quoted by everyone, the most competitive region of the world, the European Union shall become, and what has happened out of it? Almost nothing. So it's really about implementation, and that is actually what we keep on saying too. You're right. But now with this, I mean, first of all, because you had the question with the federal levels too, I find it very important. I would not say in general that the European Union should do everything in the regard of health. Health systems are very much linked with the DNA of a country. The National Health Service in the UK is very different to the French or the German system, and all of the there are passes, historical passes that have developed these health systems. So that should be organized on a national level. But there are many, many areas, and we discussed them here, that have European added value when better coordinated. And for that, and we are implementing. I mean, this trio presidency, I dare to say, with Slovenia, Portugal and Germany. From the very beginning, we have coordinated the issues, the topics, and there are many, many files. You know, the Parliament has a 5-year period. The Commission has a 5-year period, and presidencies have 6 months. And if you really want to implement something, you need coordination and you need to have an agenda together with others. Otherwise, it just doesn't work. You just have declarations and you just have discussions and conferences, but you don't have really implementation. And we have, from the very beginning, focused on certain areas and issues like digitalization, the European health data space, and we are implementing it. We have, from the very beginning, discussed ECDC and EMA to be strengthened, and we are doing it right now. There are legislative acts on the way to be negotiated, finally, hopefully, under your presidency, to be brought to a result. We have managed to have more funds, EU for Health, under our presidency. We made it till the end of December. No one really believed in it. It was a trilogue, and there is now more funding than ever. It's not yet enough, I would say, within the EU budget, but more funding than ever for health in the EU budget. HTA even, not related to pandemic, but related to where cooperation makes sense, health technology assessment for drugs and medicinal products. The Portuguese presidency, thanks to Marta and her team, has finally, after 5 years or whatever of discussion, brought it to a result. And what actually brings me just back to one thing: we need trust, we need collaboration, and we need institutions that want implement, and not just declarations. And I think we, with this trio presidency, we really have shown in the past 1.5 years, or not 1 year, and now the next 6 months, that's, you still are on the way, but you're committed and one can feel it, and we will support you wherever we can. We really do implement, and that is important. I absolutely agree, we have so many declarations all over. Same counts for the WHO. We need implementation to make difference, but we have shown it's possible, and we are making it.
Indeed, and you ought to be congratulated, actually. This trio has been extremely active with lots of proposals and real money behind, as you said, so thank you very much for that. Minister Temido, what would be your comments on that?
Thank you. I think that we need to be ready to give up something for the sake of public interest. Coordination is essential to face the new challenges, and for that we need to reinforce mechanisms at a global stage, at the European stage, but also at the global stage. If we want a Europe closer to citizens, citizens need to understand that Europe is a part of them, is important, is relevant in their daily lives. So I think that we must make sure our citizens are aware of the impact of the EU decisions in their life, and this means that our actions must be relevant in their daily lives and not only documents, papers, declarations. Maybe healthcare is the domain where this relevance is more acutely felt.
Thank you. I think it's been very useful, Mr. Temido, that you brought the element of the citizens and what really matters for them, and indeed health matters. And in spite of all the debate, I think we ought to congratulate ourselves about the vaccine, the sharing of sovereignty to buy that vaccine, and the sharing and the inclusion of all the member states. It's been a real success of working together. So as a citizen, I'd like to congratulate you. Ms. Esperanza, you're not part of the trio, but you've been very, very active and proactive. Could you give us some final sort of lessons, some final reflections?
Yeah, just a few words. Last week in Italy, we had in Venezia, in Venice, the G20 of the Ministers of Economy, the financial ministers. And the most important issue they have been speaking about was the pandemic and the consequence of the pandemic, the variants arriving from all over the world. I think that this gives us the picture of the future. Health is really the crucial theme of the future. That's why we have to work all together. We have to reinforce the health governance system at any level. We have to work on WHO, on SEDC at European level, because this is the future. And that's why I'm sure that during the Slovenian presidency, we will keep this kind of pressure to work together and to try to coordinate as better as we can our policies, because this is really the future. What happened in Venice last week was, I think, very symbolic, and is saying us that in this moment, the crucial issue is how we consider health a common public good and how we work to enforce our health system everywhere in our countries.
Thank you very much indeed. Minister Poklukar, this sounds good. This sounds that lots of responsibility for you to take forward, but lots of support from your colleague ministers and in the driving seat now. Your last comments?
Yes, it's true. All this support gives us a really big responsibility for the next 6 months. But if I continue the words from my colleagues, on one hand, it's true, we need legislative documents for strengthening EMA, ECDC and cross-border health threats. But on the other hand, we know that we need resources to think how to implement this legislative document. But like said Jens, the most important is then implementation. So we have to do step by step and try to do all what we need, that this new approach, I think that this new approach for stronger Europe will be reached. And when we talked about European digital certificate, we showed the whole world that this is possible. And the success is part of good collaboration, good coordination, and friendship between member states, because we are having 27 member states in the European Union, and I believe that all together with common approach we will build stronger European Union and stronger European Health Union.
Fitting words to conclude this session, but now I like to see how our cartoonists, how my colleagues have been interpreting what you've been saying, ministers. So first one, we have Minister Span. We're saying we were still in the 80s in the healthcare digitalization system. We need universal health coverage. We're also too dependent on other regions of the world for health security and coverage. I don't think it's too dependent. I think we're rightly interdependent. But that's really a very good summary, I think, Mr. Span, of what you said. Next one, Mr. Temido. Portuguese health system is designed to enable access. Lots of emphasis from Mr. Temido on inclusion and access. Physical and mental health must be treated equally. Very important. Mental health came up a lot during this conference. We must invest together in the healthcare workforce and organizing info systems. Indeed, workforce and information systems have been two themes throughout this conference. Minister Speranza, the vaccine should be a public right. Health is an international issue, not a local one. We have to invest more in the health system. It is the biggest investment in human life. Indeed, Minister Speranza. And last but not least, Minister Poklukar, we recognize common challenges as opportunities. In the next few years, we could have it all, a more resilient health system. We believe in a stronger Europe. You can count on us. We can count on you indeed. So, colleagues, from us here, from the studio, thank you very much indeed for following us. please stay with us because we've been announcing Professor Monti presentation, keynote, with the results of the preliminary results of a commission he's been led, where actually he's going to be talking a lot about these various international governance mechanisms, these ways to find the funds to work on these externalities. So from me, from our ministers, thank you very much for being here, and we welcome Professor Monti.
Thank you. Thank you very much, Joseph. I am grateful to the Slovenian presidency and to Minister Poklukar in particular for inviting me. And I do congratulate the presidency and the minister for this extremely interesting and timely conference. I have been asked to give you briefly the flavor of the forthcoming reports of the Pan-European Commission that I have the honor to chair. As you know, many panels and commissions have been set up in the last year or so on COVID-19 and pandemics in general. Most notably, the Independent Panel on Pandemic Preparedness and Response, set up by the World Health Assembly, the high-level independent panel on financing the global commons for pandemic preparedness and response, set up by the Italian presidency of the G20, and many, many others. Our commission is quite different. The convener of the commission, WHO Regional Director for Europe, Dr. Hans Kluge, had an original idea, more forward-looking, I must say. He wanted a commission to consider not just the pandemic, but health and sustainable development. So what was born has been the Pan-European Commission because it gathers members not selected by governments, but by the chair that Dr. Kluge decided to ask to serve, that is myself, with him, from the 53 member states. So the Pan-European Commission on Health and Sustainable Development. And what is most telling of the spirit of this commission is the subtitle, Rethinking Policy Priorities in the Light of Pandemics. So this is an independent commission, of course, given the wider and longer-term task relative to other commissions. The composition is also different because there are distinguished public health experts, like our scientific coordinator, Elias Mousialos, the chair of our scientific advisory board, Martin McKee, the co-chair, Joseph Figueras, the special advisor to the chair, Alexandra Torbica, who are here, but also economists and even personalities with a concrete political experience from various countries. So that there are the various dimensions assembled so as to be able to look into this rethinking of policy priorities. Especially because, as has been said many times throughout this conference, one thing is to come out with proposals, another thing is implementing them. And this depends so much on the policy and on the political context and on the relationship between health ministers in any government, the health minister, the other ministers, the head of the government. The same thing internationally. We issued a call to action back in March. Then I presented some ideas of ours to the Global Health Summit in May, where the co-chair Ursula von der Leyen went out of her way and expressed endorsement, hoping that the G20 would follow up. And our final report will be ready in a few weeks. I'm not going through it. Let me just indicate to you that we try not to cover the universe, but to focus on objectives and within them specific recommendations that we believe are crucial. Just to mention, we have 6 main objectives that we target. One is to implement, not just to have, but to implement the concept of One Health at all levels. Objective 2, to take action at all levels of societies to heal the divisions that left many people leading precarious lives and exacerbated the effects of the pandemic. Objective 3, support innovation for better One Health, not just for better health. We know that it is self-defeating in the end if we take care of fragments of the One Health, neglecting the others. A 4th objective is invest in strong, resilient and inclusive national health systems. Objective 5, create an enabling environment to promote investment in health. Objective 6, to improve health governance at the global level. And finally, Objective 7, improve health governance in the pan-European region, that is at home for us. I will not inflict upon you a selection of the recommendations. They tend to be very concrete, I must say, and at the end of the report for each of the recommendations we try to indicate who, when, by what means should be responsible for the implementation of the various recommendations. Now, to whom will this report be given? Obviously to the general public opinion. WHO and its member states will decide how, to what extent consider it, and to what extent they might wish to take up some or all the recommendations. And we believe that particularly important will be the take-up or not taking up by other global bodies, not all of them apparently dedicated to health or to health alone, like the G7, the G20, the IMF, the World Bank, and so forth and so on. Let me just highlight for you to get, as I said, at least the flavor of what we try to bring about. A couple of aspects. When we say health and other policies, this means health, including pandemic, and all other policies, and particularly the policies which tend to interact most with health policy are economic and financial policy, social policy, but also market and competition policies, international policy for each national entity, and many, many other policies. There are in this commission 5 members who have had for longer or shorter periods experience as heads of governments or heads of states. And therefore, it was rather natural that we should devote particular attention in our recollections, in our direct experiences, and in watching the world now, reflect on the relationship, as I said earlier, between health ministers, health policies, and the rest of the government, the rest of the nation, the rest of the world. All of us, having policy and political experience, have noted that normally the health minister is not a key figure at the table of the Council of Ministers or the Cabinet, except for when it becomes in practice the only figure there, alongside the Prime Minister or President or Chancellor. That is moments of emergency, and we are going through, have gone through one of these emphatically. But wouldn't it be more rational, more productive, and cost-saving ultimately to ensure modalities of governance so that the collegial government of a country under the responsibility of the head of the government sees health policies more as a crucially important policy for society, for the economy, for the country, all along, not just when emergencies arise. And from there, we develop a series of very, very concrete recommendations. For example, Minister Spahn alluded to something we discussed last night convivially with him, namely when it comes to rules of budgetary discipline, which each country has in one way or another, and which those countries which belong to a wider entity, such as the member states of the European Union, have also to some extent agreed and then dictated from above, from the supranational level. Well, now, as we know, these rules, specifically the Stability and Growth Pact, are being reviewed. And there is a tendency, wisely in my view, to give a special role, i.e. allow a special respect within public expenditures for growth-enhancing public expenditures, rather than mere current consumption public expenditure. But shouldn't we introduce also a parallel category, that is public expenditures which may reduce public expenditures in the future? So future public expenditure reducing public expenditures today. Of course, not all expenditures for health will meet this requirement, but some, maybe many, to be defined, to be looked at pragmatically, expenditures for health will meet this requirement. Besides helping a society to be more healthy, stronger, hence to have a higher sustainable development. So there is a lot to do in areas of governance that one would never include in the notion of health policy. This is one example. Then at the international level, and by the way, Mario Nava yesterday in his remarks from Brussels was very clear and very persuasive in my view in explaining how the supranational level now in the EU in the form of the Recovery and Resilience Facility can help member states actually do their much needed structural reforms, including in the area of health. By the way, I spoke of the European Union here, but of course we are a pan-European Commission, so we had to devote, and it was very interesting, a lot of attention in parallel to those parts of the pan-European region which are not part of the European Union, and that is geographically and geopolitically a very important part. 53 minus 27 is a high number. And so we also detail a number of proposals meant to improve health governance in the pan-European region, trying to achieve some greater integration between the, let's say, the western part of pan-Europe and the eastern part of pan-Europe. After all, if there is an aspect of integration which should transcend for the common good the state of geopolitical relations in a continent, isn't it health integration, given the extremely high communicability of diseases which do not look at these political frontiers. But I want to conclude with something we in the Commission are very keen on, and that is the global governance of health. We believe that take the Global Health Summit. That was very, very important to come up with a long list of to-dos, a long list of recommendations. But wouldn't it be more helpful if in an international body of great relevance, such as the G20, there could be, and the Italian presidency is thinking of this in one way or another, we shall see its conclusions and then eventually what the G20 will decide, but there could be a global health board, as we recommend, set up at the G20, which would bring together at the same table, not just for 6 monthly or yearly meetings of the ministers, but also in the continuity of time with a permanent chair for 3 years, health, finance, other competences, plus of course, in a crucial position, WHO, the Director General, maybe regional directors, maybe in a rotation basis, other entities of the international sphere which might help a lot, like the IMF, the World Bank. And why did we think of this model? It wouldn't be that original. When previously another important global public good, like public health is, was fragmented all of a sudden and destroyed, financial stability with the great financial crisis of 2008, 2009, how was that repaired? The G20 set up a financial stability board. By the way, the first chairman of that board was was Mario Draghi, who now this year chairs the overall G20. And that board, which did not undermine at all the existing UN order in the world of finance, that is the IMF. On the contrary, the IMF was very grateful that this effort was done by the G20. The Financial Stability Board was able to reset the financial rules to prevent a new rupture tragic to the economy and to society. Now, one could say, but the G20 is just a limited number of countries. The number can be ad hoc for this particular task expanded in a highly representative way. As I said, WHO, I think, would have all the interest in remaining a stronger, after its reform, key protagonist of global health, but sitting at a place where finance flows in mental and eventually in financial terms. I think it would be detrimental to keep a high separation between health considerations and economic and financial considerations. What about the UN? Well, one of these panels proposes that the General Assembly should set up a Global Health Threats Council at the UN. Why not? Why not? But can we expect from the UN, which of course provides the greatest guarantee of universality, but can we expect from it the sort of substantive, effective, quick actions that a body like the G20 could put in place? I doubt. So there is a magic moment of opportunity because it's crucial for health to intercept the minds of the heads of states and governments. But allow me to say, I've been one of them for a rather short but difficult period. The minds of heads of governments, also given the media, tends to focus on one issue at a time. Now it is health and pandemic. Next year it may be another challenge which may appear even more serious, even more urgent. We need a way to make sure that using this dramatic opportunity and tragic opportunity of pandemics, the health policy in a broad sense sits at the table and ensures that the momentum is not discontinued too quickly. This would, we believe, allow health to go more hand in hand with social policy, with economic policy, and with sustainable development. Thank you very much.
We thank you, Professor Monti. That was Professor Mario Monti, chair of the Pan-European Commission on Health and Sustainable Development, but of course the Mario Monti, former European Commissioner, former Prime Minister of Italy. But his background is actually academia. He's been rector and president of the famous Bocconi University in Milan for many years. So our conference is nearly over, but I'm really glad to invite the Minister of Health of the Republic of Slovenia, Mr. Janez Poklukar, the host of the conference, to conclude the conference with his own words. So, Mr. Poklukar, welcome on stage again.
Welcome once again to all. Yesterday, I welcomed you all to this high-level conference of the Slovenian presidency. We had high hopes for this conference, and I'm pleased to say that they have been met. Slovenia has many successful stories to tell on collaboration with EU. In our last presidency, we helped to launch the European Partnership on Action Against Cancer, which has led to European cooperation that is still counting to this day. Europe's work on cancer has demonstrated that value of us all working together on key health challenges. We want to use the opportunity of our presidency to the Council of EU to improve our collaboration in innovating for transforming our health systems and better prepare them for future challenges. We have heard that there are many mechanisms available, good practices ready for exchange and resources on hand, but also about the challenge of making real use of all of those resources in practice. I believe that now we need to make a real step forward. In practical terms, we could ensure one-stop shop for individual member states to make best use of existing instruments. We could also establish a platform for cooperation between multiple member states around specific shared priorities with active support from the Commission. The availability of supportive mechanism should be at the scale and speed that meets the real political and policy priorities of health systems. What we are after should not be prescribing any model. We should rather invest in developing innovative solutions and making change happen in practice. We have heard a shared ambition to increase collaboration between the member states to make our systems better prepared and more resilient. We must ensure that those member states who wish to work together can do so, and that there are mechanisms in place at EU level to support such a cooperation. COVID-19 revealed the challenges that were already there before, and it provided an opportunity for us to better work together. We must be able to respond in our health systems at a scale and speed as never before. The EU has developed its emergency tools to provide additional short-term capacity to respond to the challenge of the pandemic. Working together to strengthen health systems must be at the heart of this response. However, we all know that COVID will resonate in our health systems for a long time, and I'm convinced that we can confront new challenges best by working together. We will build on this constructive momentum of this conference and take the ideas discussed today forward during our presidency of the Council of Ministers of the EU. Thank you once again for all for participating us. Thanks for all for supporting us. And all who came to Ljubljana, I wish also a safe journey home. Thank you.